So I'm Aly Raisman. I'm a lieutenant back in our detective bureau. Obviously, it's been told to you that I was going to contact you.
Someone was. I didn't know who or what, but I thank goodness, because I couldn't imagine that I was waiting. You know, it's like
right.
Somebody call.
Okay.
You know what I mean?
I guess you come in here voluntarily
Right.
because this is under investigation.
Right.
So obviously, I need to find out from you,
Right.
from your perception, your side of things, what happened.
Right, exactly.
I've got to record it in here just
That's
because
fine.
that's what we do for interviews. So
Right.
just so you know, it is recorded.
Right.
But we do that for most people that we bring in here.
Right.
At any time you feel you want to get the heck out of here, you can get out, walk out. My feelings won't be hurt. Okay. So I guess what I'm looking for is first, do you have a driver's license? Just to fully identify you.
Oh, yeah.
I recognize you by face, but
No worries. Do you need to take it out?
thank you.
Do you need my faculty card?
Nope, that's okay. And this is your current address still? And then, do you have a cell phone that you prefer to be contacted as opposed to me? When I called the house, I didn't say where I was from.
Oh, that's my wife's phone as well.
Okay, all right.
That's totally fine.
I didn't know, so I just...
If my phone, if no one's there, my cell is...
All right, and then I had sent you an email too, which you obviously can disregard.
Oh,
So.
okay. I'm not good at emails.
No, that's all right. Sometimes some people are, and sometimes some people aren't. So the reason for the delay in me contacting you is because obviously you know the mandatory reporting protocols on campus. No? Okay. So basically what happens is that it sounds like there was a complaint made over at MSU Sports Medicine, which triggers some mandatory reporting protocols. So what happens is the Office for Inclusion is a mandatory reporter here to the police department. So they contacted me, at which time I had to wait for the person who was going to file the report to get back into town because they were out of town. So I was able to meet with her today, which is why the delay, so I apologize for that. So obviously a little bit stressful for you because you're wondering. And so what I also do is I ask Office for Inclusion to kind of hold off, so to speak, because I like to put any type of police investigation in front of an administrative investigation. But obviously you probably feel the other is more important because it's affecting your employment.
Well, it's affecting her. That's my, it's like I want to make sure that this gets resolved so that there's better understanding. Okay, that to me, everything else is irrelevant. It's really, I feel like horrid that she would feel that way, and that's why I'm like, I gotta get some resolution so that I know that I'm not allowed to talk to her and everything. But it's good to talk. It's good to talk.
So what is your, and again, I'm kind of coming in the middle of this, what is your status then? And your employment has nothing to do with my investigation. That'll be with the Office for Inclusion.
That's fine.
So what is your, I called the office earlier. Again, I didn't say who I was, but they had said you were out of the office for 5.5 weeks, so I assume.
That was the dean to make sure that, until this investigation was over.
Okay.
You know what I mean? That's appropriate. That's understandable and understandable, right? So I'm doing my autism research right now. So he said, go do your research. I'm working on some development of classes. Okay, so
you're just working from home in the meantime?
Right.
Okay, pending a resolution of the university's investigation, I assume?
Right, that to me is the appropriate thing. If someone says that, then I shouldn't be in contact with patients. You know what I mean? So this is a totally voluntary. It's like, I sat down and talked with the dean over lunch hour on Friday. And we said, you know what, this would probably be the smartest thing. So because, that's, if someone is saying that, then it's hard because I'm used to being on the other side. I'm the advocate, you know what I mean? And I'm like, no, then that is totally appropriate. So that's why we're doing this more as a voluntary, thing, so that we don't have, why was he still seeing patients?
Right, honestly, from a liability standpoint for the university.
So that's
well, it's great that you're understanding of that, obviously.
I would encourage it.
Right. So my disclaimer is I talk fast. So obviously you can probably already tell that. So if you need me to slow down, you got any questions, let me know. And I've had a lot of coffee today, so my caffeine is kicked in. So basically what I'd like to start is what you already know. So why don't we start with that, because it sounds like there's been some conversations that have already taken place. So I'd like to know what you know.
What I was told was that, the patient was concerned that I was inappropriately touching her and didn't understand why. He was touching me in my private areas, and she didn't understand why. And those are two things that confuse me, because I do this on a regular basis. This is a treatment that I lecture on. I lecture on not only here at Michigan State to the fellows and residents and medical students, but to national organizations, international. I was the keynote guest speaker in Australia to the Australian Olympic Sports Medicine for this very technique. They gave me 2 hours to lecture on it. That's why I wanted to show you the videos, because there's no question I was touching her in private areas. That's what I do. I mean, but and I have stayed off the EMR. Do you know what EMR is?
No.
Electronic medical records, so
Okay.
that's like her chart.
Okay.
So I have stayed out of her chart,
Okay.
So I don't want to.
Since she came in?
Yeah, because I don't want to be like, oh, he doctored or whatever. So it should stay in there even that, I talked about this process. You know what I mean? And then for me, I'm the type of doctor that spends, believe it or not, 30 minutes is the quickest appointment that you're going to have with me.
Okay.
It's 30 to 60 minutes, because I do a lot of hands-on and I do a lot of mentoring. I do a lot of talking, So, in her situation, that's why I'm beating myself up. I'm like, where did I go wrong? How did I not know that she was uncomfortable? That's the bizarre thing to me. Okay. It doesn't, that's why I'm like, what signs was I missing?
So that's what we're here for today, obviously, right?
Yeah.
The two sides of every story.
Right. What didn't I feel or perceive that she was feeling that I didn't get? Because if you touch someone wrong, they should tighten up. If you touch someone, and this is what I lecture on too, it's like if you do something that's inappropriate, their body reflexively is going to respond. And I didn't sense anything like that. You know what I mean? And that's why, well, maybe I was just talking too much, because I talk and.
That's what you're saying.
Yeah. But and so I'm known for this. I mean, you know what I mean? And her body, he picked me, because that's my area, and I know I can show you the stuff, but that's why I'm like, because I tell people the touch is a personal thing, but there's a difference between palpation and caressing. There's a total different, like, I tell a story, this is a true story, about when I was dating in medical school. And the reason why I went to DO school was for the hands-on stuff. And it ended shortly thereafter because we'd be intimate together, and she said, "You're palpating again," because I'm like, but I can fix this. You know what I mean? And so I was like, so I was more in tune, and that's how I've made my reputation, is very in tune to the person's body, And that's what makes me the doctor that I am, And so that's why I'm like, how the heck did I miss any signals? That's number one. Number two is also like, why, I don't get it. Why didn't she say something if she was feeling violated in any way, shape, and form? There was no communication to me, and that's why I'm like, what? Am I blind? Am I deaf? Didn't I hear or see anything? And she didn't. She never. And she felt better. My understanding was when she was done that because when I'm working on people, it's like, okay, how's it feel now? Number one, number two, what feels better? You know what I mean? And the pain was going away. She was getting better. And so if I'm resolving a problem and in constant communication with the patient talking, I don't get why she just didn't come out and say something. So those were my frustrations that I'm going over, because I obviously, if this happens once, it could happen again. I've been doing this for 15 years or whatever, and so wake up, have you gotten too comfortable? Are you too relaxed about it? And I'm like, the only thing that I can think of is that I was trying to whatever, you know,
Okay.
and she was like, I mean, we were talking about that, you know what I mean? Because what I try and do is gain confidence in a person, and then I help them, you know, because I always tell people there's physical injury and there's mental injury,
Right.
and so much of it is more mental, you know, and people, okay,
Right, very true.
okay, so if I can get to some of the causes of the pains, it's people, I get referred all the time, people have pain, that comes to me, their pain goes away. One of the biggest differences, I talk to them.
Right.
You know what I mean? And so I'm like, was I too involved talking to her, or did I get into her space? Not this.
No, I hear you.
You see what I'm saying?
Yep.
And what I was told was that what made her call Dr. Kovan was, this is what Dr. Kovan said, was because I liked the picture on Instagram. And
Okay.
I liked the picture of her. She happened to be in the picture.
Okay.
Okay, and because I liked that picture, that's what made her call Jeff. And so I'm Dr. Kovan. And so I'm like, well, is it because she felt I was stalking her? I was trying to get into her space too much? You know what I mean? I said, you know, I right now, I couldn't even tell you what she looks like. Okay? I mean, like.
But you know who we're referring to, obviously.
I don't even know her first name.
Okay.
I just know, you know what I mean? Because.
Family.
Yeah, I know. You know, but honestly, right now, and that's why I'm staying on the EMR. I can't even recall her first name. Okay? But it's like, what the heck, you know? So I'm trying to think to myself, you really screwed up because you got into her, you broke into a space that she didn't want you to break into. You know, from my thought is from a mental standpoint that then clicked off, well, maybe this wasn't a therapeutic or medical touch.
Right, which that definitely could be part of the reason why she thinks
right,
and why she's reporting what she is,
right.
Which that is a portion of it.
Right.
So, what specifically did Dr. Kovan tell you that she, so is he the only one that spoke to you about this?
Dr. Kovan told me, then Dr. Dietzel, he's our clinical director.
Okay.
Right. So, and then of course the dean.
And did he tell both of them, or how did they find out?
The dean found out through the university, and so then
Okay.
the dean called down Jeff on Friday, or Thursday, Friday, one of those days. And so then Jeff came into the office of the dean at 7:30 in the morning. So I think it was Friday.
This past Friday?
Right.
Okay.
Right. And then the dean called me down Friday afternoon.
Okay.
Okay.
So Dr. Kovan was the one that first initially met with you.
Right.
So what did he say? And obviously there was the issue of the Instagram picture. What else did he tell you?
That she felt violated, you know, that I was doing, like I touched her breast and that I moved her underwear out of the way, you know, and I'm like, yeah, you know, I do that all the time, you know. And he said that he tried to explain to her too that, because I've taught Jeff, Dr. Kovan, how to do this.
Okay.
Stuff, you know, so he was like, but he said, because she said, Jeff said also, she didn't want to make a big deal out of it. But Jeff said, because you're talking to me, I will move this forward because that's what I have to do. Because that's right, you know what I mean?
Right.
So she didn't, according to Jeff, said she didn't want to make a big deal of it. She just wanted to let me know and, you know, to try and take care of it. You know what I mean? So, so Jeff moved it forward. You know,
I assumed, or did he tell you that when he contacted?
Whoever, you know, he just moved.
Okay, so he just told you he moved it forward.
Right. Right. So that's how it got moved forward. You know what I mean? But like at that time, he was like, I explained to her that Larry does this all the time, and there's, you know, that he knows what techniques, you know what I mean, that I do, and that is true. I mean, you know what I mean? That's why I brought the computer. I think if you see the videos that I educate people on, yeah, you know what I mean, that's what I do, you know what I mean? And I can, if someone has a rib problem, you know what I mean, I can fix their rib, but if I can't, a lot of times you can't use the shoulder, there's myofascial techniques, you know, I can fix their rib by having my hand on their bottom area, and I can fix their rib by, you know, from above, okay, there's just myofascial techniques, but it's medical, that's the problem, like, how did she not,
So those would be some of the things we work through, right? So what may be helpful is if we start off with the videos. That way you can show me, and then that way, and then what I'll probably have you do, if you don't mind, if they're not too long, and you can email them to me.
Oh, I got Dropbox.
Oh, perfect.
Yeah, I made a Dropbox for the dean, you know what I mean? I can't get on.
Yeah, you know.
But I can send you send me an email?
Yep, I sent you an email.
I can send you the link to the Dropbox?
Yep, that'd be perfect.
Okay.
Yeah, they normally have our wireless pretty well locked down here.
Oh,
so.
yeah, no, I can send it to you when I get home. to be under sports medicine. I have it in so many different areas because this is my Australia. Okay, so this is what I was down in Australia doing the lecture, and it looks like I put a few in here. So this is what probably it looks like would be on the drop box, the majority of it. So let's go back in time. Okay, so this was like my first video that I ever made of this. It was made on a VHS tape.
Oh,
okay?
Lord, yeah, we're going way back.
Yeah, okay. Okay, so her parents are in the room, and I wanted to give this lecture. So she volunteered. First time I ever met her. Okay, and she had see her chest movement, So that's her range of motion right now. Okay, so this is what I do. So she had physical therapy, 6 months of physical therapy. Okay, she'd been resting, and they were like, okay, let's go see this doctor in Lansing. They came. Okay. So I'm doing the palpation of this part, but let me just go forward here. But you can see where my hand is going here now, but that's nothing compared to what I'll show you. That's her strength there, okay, but right. Let me do this here. So I tested in different areas. So now she has pain there from this, but. So okay, so now I'm doing one of her leg treatment. Okay. Go. Anyways, and then I work her up. I gotta keep going. This is just the video of it.
No, that's okay.
So now look at the range of motion just from that. Okay. Remember, the range of motion was here.
Yeah.
Okay. And then I worked the fascia up the rest of her back. Okay. So she came in with a hamstring problem. Okay. But so where am I working? You see what I'm saying? I always tell people it's like from your ponytail to your big toe. Okay. Now for 6 months, and now look at this range of motion. One treatment. Okay. And that's where she couldn't get for 6 months. Okay. You start doing this, and it's without even stretching her. Okay. The voice is off.
No, that's okay.
But so you can see that it basically doubled her range of motion without even starting. Now I'm starting to do a little bit of stretching. That's the end point. You can tell when her body language is. So that was like, okay. Back then, I was thinking I was treating like the operator internist. I was trying to figure it out. Okay, the way that I first started working in this area was a gymnast had a hamstring problem and said they weren't getting better, same type of situation, and she was guiding me. And she was like taking my hand, and I'm right in her vaginal area, and she said, that's it. And all of a sudden, with my hand there, her range of motion doubled. I'm like, what the frick did I just do? And so I did all this research, and that's how I became known for this, because I did all this research to try and figure it out. And I met with Dr. Greenman, who was he's passed away now, but he wrote the book on osteopathic manual medicine, principles of manual medicine. And he's like, I think you're doing more sacral tuberous and pelvic floor as opposed to operator interns, So, anyways, so that's why this is like, okay, that was the beginning. You can see how long ago that is.
Yeah.
So, and this is what I made for the lecture, and I do these videos all the time and send them to everyone leaves instead of paper. They do the video on their phone.
Okay.
Okay, like if I wanted to go see a therapist or a doctor in a different area. So these people came up from. Here we go. So this is in my lecture that I give now. You can see this is in our new office and everything.
Lotion, and this is for the myofascial release.
Better quality, obviously,
She
because.
does not have very good external rotation. She's got so with that hip like that, I don't want to twerk her.
Now her parents are in the room, for this too, of course. I think her mom actually is holding the camera.
Right where the ischial tuberosity.
I'm trying to show it out. You can't really see it on the skeleton there, because like I said, they were holding the camera, not.
So I'm trying to avoid that.
But then here.
Coming up right through here with my counter pressure. Over just unplug it a second. Like this. Here, just unplug the cord. There you go. Yeah, it should be fine. Come on over. I want you to actually see so Jamie can see.
Okay.
Okay, so now, here is like where the leotard line would be if she's wearing a leotard. She's got a little tape. She's been taping her sacrotuberous ligament with kinesia tape.
It's one of the things I invented with that tape job, too.
Now here's your tuberosity. You're sore right here, correct? Okay? So I'm going to come more towards the rectum. Any pain? No. Okay, so it doesn't hurt there when I push. I'm pushing at about a 45-degree angle. That's where I'm going to put my pressure. And maybe up towards the tailbone a little bit more as I come up. But this is my hand placement. Sometimes my hand has to be actually down here, or I come across. So I'm on the pubic symphysis.
Okay.
Okay. And my hand supporting the pubic symphysis in the front.
In the front.
Yeah.
Okay. I mean, yeah, I'm touching her areas. You know what I mean? That's reality. You know what I mean? That's.
Sometimes I actually have to grab right here to apply that treatment process. Okay. So now I'm going to have you guys come back over here just so they can see where.
Okay, so that is now what that's showing like hand placement. But what you can do with that, here's like IT band, pelvic floor. Let me go up to the here's like ribs. I think.
Okay, ready? So now we're going to work
just update it again.
Outside up because she has that butt head connection where she had the when she flexed her neck. So I'm going to check her here now.
So my other hand you can't see, but it's in the inner rectovaginal area.
So working half of the spine. Ligament.
Oh wait, okay, this would be testing her. Okay, so listen to what she's saying.
Now, again, I'm going to bring her leg slightly out.
She's saying it now.
Push on the tush. I'm going to bring her leg slightly out.
Go back further.
Okay, now, again, I'm going to bring her leg slightly out.
Go back further.
Okay.
This
Yep. So her
pain.
perispinal.
See, this is what I want to hear you say.
Yep.
Pain, yes, pain, yes. Did you hear that? Just
Mm-hmm.
briefly. That's what I'm doing up. So where's her pain? Is there pain? Is there pain? Is there pain? She had pain the whole way up. Okay. And now I put my hand.
To the ischial rectal fossa or the sacrotuberous ligament.
No.
So the pain goes away.
Okay. You see what I'm saying?
All the way up. Just by putting pressure on the sacrotuberous ligament. Now, her paraspinal muscles have relaxed. What I'm treating.
And that's what I've been doing with her. Is like, does it hurt now? Does it hurt now? And I changed from those different hand positions. Pain doesn't hurt? Okay. You know, so I'll take a deep breath, you know, and then I hold it and work it out. You know, so that's what I'm getting at. Is like, I get her in a position that doesn't hurt. You know, the pain's going away, and I'm talking the whole time. That's when I'm like, if I put her in a position that made the pain go away, and my hand is down there, there's no question about it.
Right, obviously I can see that.
You know, why? But it's a conversation too. You know what I mean? Number one, number two, you know, which feels better. And then I do this because I treat them seated, standing. So like here is even. Is she doing this long test?
Now if we do both here, it goes away, right? Okay, put your head back down.
Pain
Then
comes
comes
back.
Punch your foot, then goes away. That shows you how the fascia between above and below. Okay, so what this tells me is that she needs to be fascially released from
But now
so when your force on the figure. I'll say down, as you're walking. She's got a stabilized side joint. You shorten the stride,
throw the
shorten
head in here.
and you long axis distraction.
I'm doing it right
That's
now.
joint. So that needs to be low. Just let
There.
it
Okay, now watch.
hold to the side. Sacrotuberous ligament, you
Okay.
rise and applying pressure this way. So I'm pulling out. So my hand's here, okay? She's sitting and I'm pulling this way.
So she's going to be sitting on my hand. I didn't do this with her. But I'm just showing you that, you know, I do this in so many different positions. I do it standing too, okay? So now, she's legit sitting on my hand, okay? Coming up, you know, so you know bone to sit bone.
Yeah.
So my fingers are on the inside of that, between the two sit bones, pulling this way, okay? Change my position. And the pain's gone, because I have to change the, okay? So that was painful, putting my hand there, changing it because there's different vectors, forces this. So it takes the pain away, you know. Then, okay, that tells me, okay, I need to do this, you know what I mean? So, and then I actually send them home with exercises.
That's what I was going to ask. So then what is...
She sits on her hand and she does some exercises. So let's, so, and then standing, do I have the one in here? No, I bet you that's just in the actual, this is like Botsford. I mean, I've done this lecture so many times. Let's just do Botsford. Is that, yeah, let's see if Botsford shows us the whatchamacallit one. Hello.
And then, so then do you tailor the exercises they need to do depending on positionally where...
I have one patient asked to come in, and she comes up, and it's hers both sides, so she has to take both hands and push up, and it's the only, she's had pain for a year, okay? And since I've been showing her how to do it, she goes home, does it, and she's treating herself, and she's back to doing gymnastics now. But it's because of all these nerves that pass through here, too. Anyway, so this is, oh no, this is an older, the videos aren't connected. Go away. Sometimes when you convert them, I don't want, how about this one? I've been, you know, updating them, you know, and now it's like a PDF. This just shows the patterning of how through this ligament you go up and you affect the ribs, latissimus dorsi. This is all from where I found the research was in with Fleming. He did a lot of research on pregnant ladies. Okay, and so I used to joke that, you know, I took what they do on pregnant ladies and converted it to my athletes, because I work with gymnasts, dancers, and figure skaters. That's like 80%, 90% of all my patients. They're all hyperflexible.
Right.
What happens when you're pregnant? Relaxin comes out in your pelvis, and you get all these problems because of the pelvis relaxing to make room. So it's like, okay, you know, that was, so the research that was done on pregnant ladies, you know, with, okay, following this all stuff, that's what Fleming's, it's in this textbook called Movement Stability and Low Back Pain, okay? And so we're trying to create stability. So it'll morph, it'll make sense to you as I go through it. But anyways, these are from his textbook, showing you how through that, this is not just me being crazy man, you know what I mean? This is
right.
Textbooks, you know?
Nothing you pulled out of the air.
Right, exactly, you know, or in this case, out of my ass, okay, if you want to put it. But do you see how that goes? You know what I mean? It's like, it's through. And so when you're in, and this is showing how the sacrum rocks. So I'm trying to lecture. Okay, gait, how the gait is affected. There we go. So you can see how those videos are in the lecture presentation. And the slump test, where's this? Oh, like this. This is at Bella Crowley's. This is when we finally got a table in the back room. Okay, and so she came in after 3-4 months of not being able to do her pose. Okay, and her coach was a chiropractor. Anyway, so I did this treatment on her, and that's her range of motion. 3 days working on her at the gymnastics camp at our National Team Training Center, doing those techniques that you saw, and that's her range of motion. After 3-4 months of not being able to raise her leg up, okay? So I mean, that's why it's very powerful. You know what I mean? It makes huge differences, okay? This is like showing you like a self-treatment. Okay, I teach them to pick a wedgie.
Yeah.
I'm like, pick your wedgie, get in there, pick your wedgie, you know, and you need to pull and stretch, and I'm showing you, you know, then like, okay, you know, and then just showing you that they do that, you know. I teach them to do that themselves, okay?
And you said you've taught the staff over there at Sports Medicine?
Okay. Yeah, I gave this lecture at our MSU conference, our MSU Sports Medicine conference, you know what I mean, too. But, so here's standing. So this, obviously she has scoliosis, which gives you a lot of rib pain, okay? So she's not a gymnast. You know what I mean? So anyway, so she comes in from, she's like graduated, she'll come in and just for this treatment for when her back is sore. Okay, but so I can treat scoliosis because of the ribs, standing. So I treat this standing, seated, you know, and this is showing, you know, like, okay, standing, you can do it this way, you know. So, and then taping it. Okay, there's different tape jobs, and you literally come into the ischial-rectal fossa with the tape job.
Okay, to use kinesio tape.
This is one of our.
Sacrotuberous ligament runs from the coccyx down to the ischiotuberatus. You would actually start, because I would start this up. And when you do this, You want to make sure that you stay off of the rectal area, and of course stay lateral to the labia. If you get too close to the rectal area, of course they can get more skin irritation.
Okay, so I mean, you're coming right where
Right,
there's, okay,
yeah.
I mean, I'm not saying I didn't touch her there. I purposefully touched her there, okay? That's the, you know, so this was all like sacral tuberous, and over time, and I'll just go. You can see how you can put different layers there, you know.
At the same time,
But
keep
that's,
that skin smooth. What you do not want to do is create a fold of
you
skin.
know, so you can see how I talk with my hands. I'm always,
Yeah, I'm the same way.
okay,
Yeah.
you know, I mean, even on the patient's body, you know, so as I'm talking with her, trying to describe things, I don't know, you know, I see so many people, I don't know. But what I do know is that I've been doing this for so many decades, you know, not decades, but since like 1997.
Okay.
You know, like, why now? What happened, you know? And then, so that's where I switch over. And as I move over years, you don't just, you create, you still keep doing things, you know what I mean? And so I, where is the, oh, you get a kick out of this. I'm not a kick, but this is my leotard.
Okay, this is, let's see, it is July 25th,
This is my 2013.
We are in the process of the first prototype.
So I'm trying to put it into a leotard.
Yeah.
Okay, okay.
Cross, turn around.
So these were like,
So we have an axis.
this was the very first, but you can see how.
So we have the wider.
And then I've got pictures of all this too as I've been developing it. Because now Under Armour is our sponsor.
Okay.
And Under Armour makes core shorts. And so this is like a core. So we have Under Armour and
One on one side, one on the other side, creating a V.
to try and lift.
Overlap, so it's a smooth togetherness there. And then we lift, and lift. That's going to help keep the tummy tight. This would act to hold down the straps, okay? And then let your arms fall.
So this was our first demo of it. But you can see how it comes up, you know, to lift and shift. And it basically, it's like, I mean, I'm literally trying to design how do I put my hands on the leotard. You know what I mean? Like, so that they can wear it and have the same type of biomechanical support, you know? So we have Jim Kin. I've met with the people at Jim Kin, and since Under Armour is our new sponsor, I thought this would be a great project for the two to work together. Okay, so I think on the Dropbox there's actually more pictures of that.
Okay.
But I need to get to the other. So what I've gone from is from operator internist to sacrotuberous to going into more. No, it's not there. Transfer. There. Video lectures, USAG PowerPoints. Pelvic floor work is what I'm trying to find that lecture. It's in the gymnastics injuries. This is the latest, I guess you could say. Core lectures. Did I put it in core lectures? Straight into core, back, core. Okay, let me grab it.
No, that's all right.
Is that okay? I'm sorry, I'm not taking too much here.
Nope, that's what I'm here for.
Okay.
And that's what we're here for, is figure out exactly what happened so we can take all the time we need.
Are you sort of seeing, I mean, this is literally like, gosh, I wonder if those are on there too. Like the Romanian National, Romania for Gymnastics, okay? Their trainer, I just made up videos for them. Where are those? Let's go here. I thought I know they're on the Dropbox too, but videos. Let's go to this external hard drive. I should have just put them all into.
Well, you didn't know I was calling you this evening, so it's not like you had time to prepare, really.
Anything, right.
But you knew at some point I was calling, but.
Right. Videos for lectures. Hip Eval USAG PowerPoints. Is it underneath? Sacrotuberous, but where's the floor? I bet you it's just underneath my lectures. So I make lecture. I mean, that's what I do. You know, all these videos that I do, they all go to the people so that they know what they're doing when they go home, you know. Let's go here. 2 lectures, transfer Lectures. So this was the most recent lecture, and it would be on PE, pelvic floor. All right. So this I gave at USA Gymnastics National Congress, okay, and I gave it also at the last year's MSU Annual Sports Medicine Conference, okay? So that's why it's like, okay, the grand junction was the sacrotuberous ligament, okay? And then I do a lot of pelvic floor work because gymnasts have a lot of urinary incontinence, the force of pounding, and their urethra's small and they pee. I don't know if you've ever jumped and peed, but
sometimes when I run.
Right. So gymnasts are like known for that, So I talk about urinary incontinence and all that stuff, and but this is where I get into more like the culture of it. Okay. Yeah, there you go. The PP problem is a don't ask, don't tell issue, because literally we have to do like PP interventions at times because the little one has the PP problem and we got to talk to him about it. But okay, so this is like, because she actually hurt her hamstring up high, but she's like her hoo-ha, So she who must not be named, it's like I try and been educating people about these techniques, It's like everyone can't even say the word vagina, It's like, hello, you're medical professionals, Like I've sent people for intravaginal pelvic floor work to Sparrow Hospital. Sometimes you actually have to go intravaginal, too, for this stuff. And so, anyway, so I'm going through the anatomy of this stuff and trying to explain how the muscles, like I've had kids actually strain these individual muscles that I found from physical exam, and people are like, you're full of crap. I do an MRI, they sprain that muscle. I know this area, it's whatever. That's MRI. So what we try and do is we actually teach them to use their pelvic floor muscles. Because if they use their pelvic floor muscles right, it actually increases their core stability. So it's when I'm in the pelvic floor area for this obturator and sacrotuberous ligament, you can't help but affect the pelvic floor. And the pelvic floor is known to actually, if you have this more stable use of your pelvic floor, it actually increases your core stability. So I tell people the core to the core is the floor. Start with the core by using your floor. Okay, so I'm trying to educate people on how to use the floor, and because that's what I figure I'm doing a lot of times is even though I'm there, I'm affecting the floor. And if I can get the floor to contract well, then I can get their their back muscles to work properly. Okay, so I talk about Kegel muscles, so this is part of their exercise programs. You know what I mean? So that's why it's a little bit different. For my athletes that I've done this on, they would have had these home exercise programs, okay? Okay, literally. Okay, I see athletes, okay? The only way I don't see it, the only way I see a non-athlete is as someone saying, will you do this? Okay. You know what I mean? So it's like, yes, and then talk about jumping anyway. So these are like trigger points, areas that are mapped out, on the body and stuff. But there's I call it the butt prof, the lift and shift, kinesio tape. But there's another one. Oh man, pediatrics, pelvic floor.
So then you just know.
You know what I mean? So, that's why I'm like, I'm missing the ones for the Romanian gym, the Romanian doctor too. I know they're around here someplace, but I don't think has it at the end. This is another lecture this is the American Osteopathic Academy of Sports Medicine. It's the national sports medicine, like all the doctors of sports medicine doctors in the country. There's 2 more gymnasts that I had done it on too, and look at the range of motion afterwards. But anyway, so understanding the biomechanics of a single ligament makes a big difference. There's more that you'll see in the Dropbox. Okay. You'll see I mean, I'm pretty graphic in the videos, okay? And
Which
the
is
ones
obviously going to be helpful to the investigation.
And the other videos actually talk about, and that's, I know they're on there. This is starting to irritate me just a little bit because I'm like, where the heck did I put them? It'll be, here's the, did it load up? Yes, I was loading up to send some more stuff today. But it'll be, I think underneath this, it'll be like a sacrotuberous, okay, just to let you know, hey, can I actually do this? No, that's not all of them. What happened? I thought I better add those ones with the Romanian gymnast. Okay, Larry, bear with me.
No, you're fine.
But that's why I'm like, you know, I'm like, I do this is what I do. Why didn't I get the idea that she was viewing, you know, because I have to feel, I mean, like, I do this on minors, you know what I mean, with their parent in the room, of course, but you have to be able to communicate, you have to be able to sense what the heck is going on, and why I didn't get that feeling from her is beyond me, and and that's a question, I guess, that I can't answer because I'm not talking with her, but she did not vocalize anything to me that she was feeling offended. If anything, like I said, she was feeling like I was, yes, you know, I feel better. Okay, so that's why I'm like, if she's feeling better, why, what ticked her off to start thinking, like, what the heck is this guy doing? You know, and that's, this is just going to be irritating now.
Yeah, if you can't find him now, that's okay. You know,
okay.
it's
Go ahead. I can look while you're talking more. You know.
So when Dr. Koven initially talked to you about this, so it seems like there was a some time that went by from when he initially talked to you to when you were talked to again. Mm-hmm. When he initially talked to you and you guys had your conversation, what was the resolution or outcome of that conversation? So he tells you, hey, you know, she comes in here.
Right. I wasn't that worried about it. I mean, at that point, because he had said he explained it to her, and she didn't want to make a big deal of it. Was his words.
Okay.
You know what I mean? But he said he had to move up the chain. You know
and that he explained the procedure to her when you say he explained it to her? He
explained it to her. I can't talk for him.
No, I'm just curious if he told you.
What he said is that I tried to explain to her what you do. You know what I mean? And so those were his words, you know what I mean, or paraphrasing because I can't remember word
No, that's okay.
But, you know, and she didn't want to make a big deal of it. And so those are the three things was that I remember from our conversation or four things was, it was after the Instagram picture and the moving of the underwear and moving of her breast, and because I was treating her ribs area, and then that she didn't want to make a big deal of it, but she thought she needed to talk to Jeff about it, and then Jeff saying that, you know, appreciate what you're telling me, so I will move this up the chain.
Okay.
Okay, so that was like the...
So then it was just kind of left open-ended for him to follow back up with you?
Nothing else that happened. There was no conversation until Friday.
Okay.
Okay, it was just so I figured, okay, nothing ever happened, you know what I mean, like, you know, then once it did actually then make it up the chain, and the dean called in Jeff Friday morning, that's when it's like, okay, so obviously she's making more of a deal of it, you know what I mean, than not wanting to make a big deal of it. And I told Jeff at that time, I said, if she felt that way, I would encourage her to say things. You know, if she were to talk to me, you know, to say that some doctor did something, I said, you need to discuss this. You know what I mean? Because that's what I am, more of the patient advocate than anything else. It's my role. That's me. I don't know how else to say it. It's like me. You know,
right. Everyone has their own style.
Yeah. Well, it's not just style. It's you. You know what I mean? As a person, to be able to do this stuff, and to be able to do this stuff for so long, if you don't have patient confidence and patient trust, you would have had my ass in here how many times?
Right.
Okay, especially when I'm doing this on 10-year-olds, 12-year-olds, okay, with their parents there. But I'm obviously doing a doggone good job explaining things, okay, because what? You know
yes,
what I mean?
That was going to be one of my questions, obviously. So there's never been any complaints that you're aware of prior to this one? And obviously you're videotaping things here. You're doing
right. Well, this has been going on for forever. You know what I mean? Like, not forever, but the videos, you can see I've been videoing and changing and adapting. So I keep, so that it's transforming, you know, from being just the operator intern to sacrotuberous to pelvic floor, you know what I mean? So all of that is the fulmination. the end point. I guess I can't find it.
No, that's okay. Don't worry about it.
But you want to see the ones with the, and listen to the words that I'm saying too, okay? And just watch my body movements, okay? When I'm checking things, you know, when my hands are on the patient, please watch, because I could see how she's massaging my breast. No, I'm like, how's that there now? How's that there? You'll see my hands move, okay? It's talking with my hands. It's how's that feel there now? It's like I tell people, you don't want to use left, right, or to your left, or you move it so they know what you're talking about. They can sense movement, right? So if I try to describe how does my left hand feel next to your right, you know, no. Right. But if I go like this, you know what I'm talking about, okay? So it's the way that I communicate because your hands are on them. Okay?
So that is exactly what we're talking about. So was there more details given to you on Friday then? Did they go over, because you said, hey, they came back.
On Friday, what the dean said was that it's been moved up the chain, and that this could become a police issue, or that it could become a police issue if she chooses to file a police report or whatever, and that because of that, it'd be in your best interest, in our best interest, if we don't have you see patients right now, because
which makes sense, like you said.
Well, yeah, and I'm like, sure. He goes, so you take the time that we need. I said, you could do the research, do the academic work that I'm doing. So I said, that's exactly. What I mean? So I'm not even going to the high school. I go to I'm Holt High School's team doctor. I'm the team doctor at Twist Stars. You know what I mean? So it's like, okay. So I guess that's where I'm getting at is, what communication did I miss that she was trying to tell me? Okay, did she say anything about verbalizing that I feel uncomfortable or anything like that? Because if she did, I didn't hear it.
So those are some of the things that I'll go over with you. I can go over in very fine detail as to what she said. So I'm not going to hide anything from you. There's not going to be any secrets. I'll go over all that stuff with you.
Okay.
I just wanted to know kind of what you knew up front, and then obviously I wanted to see the videos because what I'm seeing in these videos is basically very similar to what she is telling me happened.
That's what I do.
Yep. So that is why I wanted to see those first to say, okay, are we on the same page? Are we talking about the same thing from the get-go? Which we are talking about the same thing. I've seen those. So it'll be very important for me to get those videos, and especially the ones, if you have ones in more detail, like you said, are a little more graphic.
The ones I sent to the whatchamacallit, to Romania.
Okay.
So those were just done for 2013 European, so last summer.
Okay.
So getting ready for the 2013 European Championships, and was having a problem, and so they contacted me to say, hey, what can you do to help? I mean, England, Canada, Germany. I mean,
Right.
This is what I do. Okay, I'm not saying that yes, I'm there, and yes, it's medical. It's not, I don't know how else to say it, but I'm totally taken by surprise, but at the same time, feel like crap that someone would feel that I was doing something inappropriate to them. Because this is how I make my living. This is what I do. I've helped scores of people by doing these personal issues.
Which is good to hear. It's good to hear that you feel bad that she feels that way.
Yeah, because I feel like this little deviant, and that's not right, and that's not. Okay, I mean that's reality. Okay, that's who I am. Okay, that's why I'm like, of all the freaking people, I'm the only guy even allowed in with the national team. Okay, it's all our females. Okay, but because of who I am, it's the trust. If I did something wrong, do you know how quickly that would spread like wildfire across? Right. It's my 27th year with the team, or whatever, since 1986. I've been with the national team, and I'm telling you, those kids, it would go boom, chuck, boom, chuck, boom, chuck, chuck. You know what I mean? Like, no question about it. Okay, and that's what I'm saying is that there has to be a way that a person's able to disconnect. Okay, if you don't disconnect, then you're screwed. You know what I mean? You got to be able to disconnect, because that's what I'm saying is that when you're in that area, you have to be palpating. You have to be doing therapeutic touch, not any other touch. because that sensations can be relayed through your hands. Persons can tell. You know what I mean? And it's like, how did I miss that signal that she felt that I was doing it inappropriately? Was I really that off that day or what? You know, that's my issue. And it's hard because it was so long ago, you know what I mean? But it's what I do all the time. So was I tired? I'm like, okay, did I get to sleep that night? Did I, you know what I mean? I'm just trying to figure out, was I off? Was I wasn't sick? You know what I mean? I only get 5 hours of sleep usually a night anyways, you know, but that's normal. Like, did I get less than that night? You know, what made me out of sync? What made me not be able to recognize that I was making a patient uncomfortable? Okay?
So generally, do they verbalize that, or a combination thereof?
There has been a few times where that has been brought up, okay? And in each and every time there was sexual abuse.
Okay.
So that's what I'm saying is when they're uncomfortable like that, there's been 3 cases, and all 3 of them were sexually abused. Okay? So that's why I'm like, yeah. Okay? That's why I'm like, okay, is there something more? What am I missing? Because that's what I'm thinking all the time. Okay? If someone's tensing up or having an issue with this, my first inclination is, were they ever sexually abused? Okay? So that's what I've had conversations with people about, you know what I mean? And now I'm the one on the other, that's what I'm saying, is I'm the one on the other side of the table now, you know? It's
right.
Like, so I'm like, how did I, if say if for God help me, she's never been, you know, sexually abused, but say if she was, that's my job. Why would I miss that? Because then it's my job to bring help to that. You see what I'm saying? So where am I losing it that if she, God forbid, had been, that I would have missed that cue? Because then it's like, okay, boom, chaka, boom, whole another period of like, it's time to have some psychiatric intervention.
Right.
You know what I mean? So that's why I'm like, yeah, okay, yeah, 3 times, okay? And so that's, yeah, though there's been other than that, and each one of them were in the past sexually abused, you know? And so, but I'm the one who brings it up.
Right.
Okay?
Right.
You know, she's way uncomfortable for what I'm doing, you know, without them even having to verbalize, okay? Because
obviously, you can feel a change in their body.
Yeah, okay, it's like, that's not right. There's something wrong here. You know what I mean? And so then I talk to, each time it was with a minor, you know, then I talk to the parent, and I'm saying, you know, what's going on here, you know, and then I find out what's going on. Okay?
So you obviously talked to, it sounds like, okay.
So I just was waiting since Friday when I heard that it did go forward to have this conversation, because I don't want her to mentally be going through what someone would be going through when they think that they've been sexually violated. Okay? That's the problem that I'm facing, is that it's a dichotomy for me. It's like, I'm the person that usually puts the arm around them, not the one who's you know, doing the wrong thing. That's the dichotomy that I'm stuck in.
And you're right. So that's what she filed a report for. So right now what the report is titled, just so you know, is a sexual assault.
Right.
Because that is, like you said, that is how she's feeling. That is what she thinks happened. That's her perception of things. So there's a couple different times that she's feeling that you sexually assaulted her throughout the examination.
Okay.
She did say everything that you were telling me is along what she said. Hey, it was a lengthy examination,
right.
Went to these exercises, right. You were working on basically her whole entire body.
Right.
So, you know, everything you're walking me through over here and you're showing me is everything that she was telling me. What she is saying, and you use the words, the same words she used, that she's saying that.
Right.
And then she said that she felt like that you were massaging her breast and that was not part of the manipulation that you were doing.
Okay.
So that'd be the first piece.
Right, okay.
So if you want to talk about that first piece as what it is you were doing.
Right. When you're working ribs, okay, if you can't use the arm, if your shoulder, it's like, okay, the muscle energy part, I'll crack a back, okay, so we crack a back, crack a neck, the usual stuff, and then we try and do push against me, and then you do stretches, okay, so when I'm doing stretches, okay, you're on the...
Yeah, and again, if you have videos of that too, that would be helpful.
Let me show you here.
Not that you necessarily have videos of everything, but...
I teach the ribs. I gotta find where I'm at, sorry. Videos transfer, I go back to transfer. Not a lot of people like to treat the ribs, and because I work with the crew athletes, I treat a lot of ribs, because the crew athletes, have rib issues, obviously. But that's what I mean, so that's another area that I do a ton of lecturing on, because I treat it a lot. I'm in the wrong. I took stuff off my computer was getting too big, so that's why I got the external hard drive going. Let's go to the external hard drive. No, go up to lectures and articles. OMM. Lots of lectures. All right. OMM, ATC, for example. Ribs, ATC, rough copy. Let's see if that's... Okay, so like, this is Dr. Greenman, like I was talking about, okay? So you can see his hand placements, okay? So what I tell people is, when you're working on the ribs, okay, I don't like to stand on the side. I do it sideline, okay? I'll be at their head, or I do it sideline, okay? And I tell people, don't come in this way. That's offensive. Come in this way, okay? If you come in over their head, that's offensive. You know what I mean? It's just the way that I talk about it. So I actually come off from the side, okay? And then I'll turn their head and do some work that way with it. But that, to me, is a lot... When you come at someone this way, that's more offensive.
Seems assaultive.
Right, exactly. And that's why I'm like, I lecture to people about how you try and not... You come across from the sides, and then when you sideline them... you can do it sideline sitting, like showing a prone. But it's the rib cage. You know what I mean? You're going to be on the chest wall. You move the breast down. You move the breast down to get down to the wall. Okay? It's like giving someone a mammogram almost. Okay? And when you do the myofascial, let me see if I've got the. Oh, don't save.
So while you're doing this, are you explaining,
I always do, because I have to know if it's making them feel better. That's why I'm like, is that bad? Because if that doesn't work, I'm going to change my hand position. If that doesn't work, it has to be a conversation. I'm not omnipotent. You know what I mean? It's like, and that's why I'm like, I don't understand why she just didn't say, I don't understand what you're doing. Or anything along those lines. It's like, really?
So she did say, while you were working on her, that you did say, does this feel better?
Yes.
And that you were going on with that. What her perception is that you weren't explaining what you were going to do beforehand, so she didn't know what was coming. But that she was very well aware that while you were doing that, you were saying, how does this feel? Does this feel better? And then she was answering, either yes or no.
Oh, right.
So again.
Because I can't remember, but I do this on all my patients. If you do the same thing every time,
right. Yep.
You know what I mean, then I'm like, okay, if I was treating ribs.
Please work, we have to do the same thing, do it the same way every time.
And then you don't screw up, you know what I mean? So that's why I'm like, so where did she... I don't know if you can tell me that, but did she ever say anything to me?
Yes, I can tell you everything. I have no problem telling you.
Did she say something like, I feel offended, or what are you doing, or can you explain it to me better, and I blew her off?
So what she's saying is that while you were, what she said in her words is massaging her breast, what she said is that at some point she tells you, okay, you don't need to work on my shoulder anymore.
Okay.
I don't need to work on my shoulder.
Okay.
It has like longer term issues and I
Okay.
need more work than that. Do you
Okay.
remember that at all?
I don't remember, honestly.
Okay.
But so did I stop working on her shoulder, or what did I do?
Yes.
Okay, so she said stop working on her shoulder, I stopped working on her shoulder, okay.
Yeah.
So I didn't do anything against her wishes. I mean, right, she said to stop, I stopped, okay.
So what she feels, and again, this is her perception and what she
Okay.
feels, and you're showing me videos, you're explaining everything
Right.
too, which makes sense what I'm seeing here
Right.
too. What she's saying is that, initially your hand was up kind of on
Right.
her top shoulder area and
Right.
slightly on the top of her breast,
Right.
and then moved down
To
again,
the
like
wrist. Right.
to, and what she calls is like a full frontal on top of her breast, and that you're massaging her breast. So,
Okay, go
nope.
ahead. It's okay, I understand her perception.
Yeah, and so
you can obviously see how she could feel that way. And when we do myofascial, too, you are having her breathe, take a deep breath, exhale, and you're doing that, okay? I mean, as they're breathing, you're doing that motion to try and stretch the fascia, okay? Go ahead, I'm sorry.
no, you're perfectly fine. It's good for you to talk a lot, right? Because then it's more for me to know. So I'm not going to stop you from talking. I prefer you talk more than less. So you're not going to hurt my feelings.
Right.
So what her perception is that she didn't know that was going to be done,
Okay.
but that there was the communication throughout that, hey, how does this feel? Does this feel better? Does this not feel better? And then she said she got to a point where she felt uncomfortable and she thought that it was inappropriate and went to the line of being from a medical manipulation to being inappropriate, at which time that she had said, hey, I think you've worked on my shoulder enough. I don't need you to work on my shoulder enough.
Okay.
And again, I know you see a lot of patients. I just don't know if, you remember anything specific to that or her
That's
saying
what I'm saying.
that.
That's what I was wondering. But at least I would do if someone says, okay, I think you've done enough. I stop.
Right, which is what she said you did.
Right. So okay, go ahead.
So that's the first piece of it.
Uh-huh.
Then she says in the first video that you show me where she's flat on her stomach.
Right.
And then what she says, again, just like you're showing me and you're explaining to me, is that your hand had went in between her butt cheeks.
Right.
And then she said the head went more towards her vagina and the vagina hole.
Well, not.
That's the way she's explaining it to me. So,
Okay.
and again, I'm not using medical terms, I'm using her
That's
terms,
okay.
right?
That's okay.
So what she says that your fingers went by her vagina hole, and that she felt again that was a massaging
Right. Okay.
nature, and that she felt that had went on for too long, and that you hadn't explained it to her prior to you doing it. So it was unexpected to her that she didn't know that was coming. And then when you were doing it, that she felt like it was not.
Was I talking to her during the time though, like I normally
So
do?
she says, yes, again, that how does this feel? Does this feel better?
Right.
And she says that initially she says, yes, it does feel better. So you continue.
Right.
And then she says that at some point that she says that she felt that it was hurting. So she says, hey, that hurts. Can you stop? And then you said you stopped at that time again.
Okay. That's what I'm saying. It's an interaction, and I don't know how to say this, but that would be appropriate. It's like, you're working on them, and you're trying to and trying to do the work. You need that feedback from the patient, and I'm getting the feedback, and I'm responsive to the feedback, and I'm talking my way through it, as she said I was. You know what I mean? And so, I might have, I haven't been on the records, but if that was my second, third, I don't know, I had seen her before, I know that.
Okay.
So that it might be in the note from before that I explained to her. Okay, so if you check the notes, okay, and see, if there is check the notes and see. If it's maybe, because sometimes I'll do that. If it's a repeat patient, I don't explain it all over again. Because I explained it the first time. You know what I mean? So that's what I'm saying.
So have you done this type of...
I don't know if I did it on her the first time or not. Okay. What I'm saying is that if that was in my treatment plan, you know what I mean? Like, okay, this is what we're doing when you come in, this is the process or whatever. I might have explained it to her the first visit. Now make the appointment and come in you know what I mean, and we'll do the work the second time. So it might have been like, you know, when you, okay, the first time's an initial eval, I might like, okay, this is where I probably will go with this, and I would have explained things in the first visit about what we're going to do the next visit, okay? So that's when it's a follow-up. I usually don't explain as much because I think I explained a lot, and I just get to work and I talk through it. So that would be part of the documented medical record. Okay.
How, your office, how would she go about signing release to get those medical records to turn over to me, or how would that, is that how you get your normal procedures over there?
Yeah, it's the release because of HIPAA.
Yeah, right. Obviously, I would need a search warrant for that stuff.
Right.
If
she
she were to
copies of the records, you know.
Okay.
Yeah, and so, you know, and then because I don't want to be on there, you know what I mean? So, you know, whatever's there is there. Okay, so whatever. Okay, so that's what I'm saying is that it would have been if I explain stuff, a lot of times I'll explain it in the first visit. Okay, but from now on, I'll tell you what, this whole thing is getting changed because I cannot have anyone leave feeling that way again. You know what I mean? That's the bottom line. You know what I mean? So
right, which is why you're here today, obviously.
Exactly, because there's no way. So, I mean, lots of things have to change to protect myself from having that, you know, happen again. You know what I mean? And also the patient from feeling that way. But it's like, okay, you know, what can we do? You know, da-da-da-da-da-da. So it's like I've already been talking with Dr. Kovan and Dr. Dietzel, you know, like, okay, you know, we need to do this, we need to do that. We're talking about policy changes, you know what I mean? So that, because we all go in the rooms by ourselves. You know, my wife is at the Alliance, you know what I mean? And she says she gets sometimes her exam done with just the doctor in the room. You know,
so that can be one of my questions, because she had said that there was a resident in the room for
usually
a fair
or
amount.
medical students, or right, that or a fellow. You know, there's a bunch of people that rotate through.
Okay, so then does the resident, and again, just because I don't know your guys' procedure,
right.
Does the resident normally stay in the room the whole time, or they come and go?
It depends on when the next, because they usually go in first. You know what I mean? So I don't know if the resident went in first on that. It's been a while, but the resident will usually start, report, you know, or it depends on where we are. Like if I go in the room with the resident, then I'll go through stuff, and then if the next patient comes, I send the resident to the next patient, because that's part of they have to do an eval and then report to you what they saw and all that stuff, you know. So then if I will be in the room, either the resident goes in first and I join the resident, and then we work, and then the resident, if the next patient comes, the resident can go to the next room, you know, so that we keep the traffic flow going. So that would be the process of normal routine. It would be because I only have 2 rooms, and if I hear the patient gets put in the room next to us, I'm like, go check if the patient's ready, go start seeing the patient, you know, and it depends on where that resident is, because the residents learn. I teach some of the residents, if they're DOs that do manual medicine, some of these techniques, like put your hand here, do that, you know what I mean? And then I say, okay, you know, go to the next room. If you're ready, you can, you know, so it's like see one, do one, teach one type deal. You know? So, you know, it depends on which resident it is, you know, as to where they are in the rotation and training. But yeah, the resident could have actually done some of this.
So do you remember in this specific incident, like when the resident left, or was it in there?
I don't remember, you know, but if there was a resident, that would be and Dr. Kovan actually, not just said that, Dr. Kovan did bring up that the resident left, that there was a resident, the resident left the room. Okay, so if the resident left the room, it was to go see another patient. Okay, but that would have been the only reason why the resident would have left the room, was to let a new patient come in. You know, so that's again, that would make sense because that's what I always do. That's a standard procedure.
Okay, so obviously that's one of her concerns too, is that, you know, she felt comfortable while the resident was in there, because obviously there's 2 people in there. The resident was a female at the time, and then she said that when this occurred, the resident was no longer in the room, and she didn't know, obviously, you know, what the intention of that was, because then that's when these manipulations were taking place.
Yeah, so it depends on when that resident was in their rotation. Okay, so that's what I'm saying, is a lot of times I will, if they're DOs and they've got a manual medicine hint, they'll actually, or tint, whatever, desire, you know, they'll learn this stuff.
Okay.
You know, like, put your hand here, do this, you know what I mean? And so, and I don't know if that resident was one of those, because if it's an MD resident, they don't have a...
Do you know who the resident was for that one? Do you have a specific resident assigned to you, or residents assigned to you?
We have residents, no, they rotate through on, it could be a medical student. I don't even know if it's a resident, you know what I mean? It could be a medical student.
All right.
Okay, so, but that's that's normal for a lot of us, you know what I mean? Like they go in and see a patient, so they're in the room by themselves with the patients. That's just the way it is.
Would Dr. Colvin or who, do you know who would have that information as to which resident was with you that day?
Vicki Curley, our office manager,
okay,
would be able to figure that out, I think. You know what I mean? Because there should be a rotation graph or whatever.
Okay.
So Vicki Curley, our office manager, would know that. You know. So do you want me to try and get that information to you?
I can call.
Okay.
Just because obviously I'm going to want to talk to the
Residents or whatever.
Yeah,
right.
because obviously they were in a room. It sounds like for almost. I'll even go as far as like 3/4 of the examination time.
Right.
So I obviously want to talk to that
Right.
resident to find out, hey, what did you observe during the
Right.
3/4 of the time that you're in the
Right.
room?
Right.
When did you leave the room?
Right.
And how did you come about leaving the room? Things like
Right.
that.
Right. Right. I would have been to have seen another patient.
Okay.
So unless it was the end of the day and they had to leave, but that's rare.
Okay.
It would have been to see the next patient.
Okay. And so then you were trying to schedule a follow-up appointment with her. And
Normally I say when I do this, it's like, okay, if they respond well, I'm like, okay, we'll do once a week for like 3 weeks, and then
Okay.
you're usually, it's like once a week for 3 weeks, and then then usually I tell people, you're like 80 to 90% better, we'll spread it out, we'll put an appointment out there for a month after that or whatever, you know, to see if you can hold the treatment, you know what I mean? But it's usually like initial appointment, then once a week for 3 weeks, if this stuff works, you know what I mean? So the manipulations. And so if it hadn't, if there was no benefit from the treatment, she'd have been off. I wouldn't have even had, we're like, okay, you know, you didn't benefit from it, I'm not going to do it again, you know, type deal.
Okay.
Because you see the effect, you know what I mean? It's like, and obviously she must have, like she said, at first it was feeling better, you know what I mean? But then she's, processed it, like, wait a second, okay, so then obviously she felt violated, you know what I mean? But the feedback that I was getting was, okay, she's getting better, you know, that's the way that I was, the communication, reciprocation, that's what I was feeling, okay? So that's the confusion, I guess, that I'm having is where did I not sense any bodily changes, you know, because obviously she said, okay, you know, that's good or whatever, and I was done, you know what I mean? So there was no other mannerisms there's no other mannerisms I can figure out how I would know that she felt uncomfortable, okay? That's what I'm getting at is why, that's why I'm having like, okay, when did I see that patient? What did I do? What clues? What am I missing here? Okay, because this is a normal process for me. Okay, that's why I'm like, why this person? Why that time? What the heck happened? Okay, and so that's
Right.
You know, it's like, you want to talk about a nightmare, you know.
Yeah.
Okay, but so it is what it is, but that's why I'm like, I had no ill intent. I had no reason to. It's other than.
All for medical reasons.
Well, of course, you know what I mean? That's what I'm saying. It's like, this is my need. I don't know, you know, it's like, and so I don't know what created me to have a bad day that day that created this out of all the times that I've done this. It's like, what the heck, you know, so I don't know. I don't know.
Obviously, like you said, you're not picking up anything from her body that you're thinking, hey, she's feeling uncomfortable.
Yeah, I mean, you would get that, and you would get that tensing, you know what I mean? You get that.
So do you remember her, and I obviously gave you the information for both times when she said, hey, you know, I don't need you to work on my shoulder anymore. You're saying you don't remember her saying that as far as that
I
goes?
can't remember all I'm doing is generalizations. Like, I know that if I was treating her in that way, this is what I must have been doing. You know what I mean? Because that's standard. That's normal. Okay. So, you know, to remember, how can I honestly say that I can remember the details of every part of it? That's not, like, that's not.
Yeah, and I'm asking just because obviously the details are helpful if you do remember them.
Right.
And then as far as when you were down, by her vagina, is that something that you remember as far as her saying, that hurts or stop or anything like that?
No, I don't. I'm honest, I don't. But if she said stop or hurts, I would have stopped and changed.
Okay.
That would have been what I should do. So if she said that, that should have been my response. Okay, so that's hopefully what I did. So I hope I stopped or made it so it didn't hurt or whatever. So, but it's clear. it is clear in my mind that obviously I was doing those techniques and trying to explain to her as I'm going through it. And so I'm like, well, obviously, there's going to be a disconnect that occurred, and how come I wasn't aware of that disconnect? That's going to be my big issue that I have to wrestle with, is why didn't I understand that at that time I had a patient feeling that way? Okay, that's my biggest, that's my big issue that I got, because that's from in here. It's like, what? Wake up, like, why? That's going to be that'll never leave me. Okay, that's my self-torture, I guess you could say. That, yes, she was victimized. Yes, I was victimized to myself. Okay, because hurting someone like that ain't right. Okay, it's not right. Okay, and that's what I'm saying. That's why that hurts me to hurt her, if that makes sense.
Yeah, I'm following you. Yeah.
So, anyways, that's what I'm going to have to live with. That's plain and simple. Okay, and that's why I keep rolling in my head. So I need other safeguards, because if I can't find out why, I got to have other safeguards built in that is other than my own use of force, Luke. Okay, because I need to have some other, and so it's got to change, because it's done. All these years of work is done. Flush it. It's done, because I cannot do that to another person, and I cannot live through that for myself too. So it's like, okay, total rework, what are we going to do? But it's got to change. It has to.
Right. Which is true, because like you said, we need to make sure that everyone's covered.
Yeah, well,
right.
You're thinking like, I'm sorry,
yeah.
You're thinking like a police officer. I'm thinking like I don't want
yeah,
coverage.
I am a police officer,
I know,
yeah.
I'm thinking, it's not about coverage, it's about morals and ethics and how people feel.
Right, which is your doctor's speak.
No, that's...
Right, we're on the same page.
Okay,
we're on the same page.
Yeah.
So for those other videos, did those show more in detail? I know you said they're graphic, but are they showing like the exact hand placement and where they're at?
And I'm talking about between the veg, and the rectal area.
Okay.
And I'm working up toward the rib cage now, but I don't have any videos of the techniques for the rib cage, other than the lectures that I have.
Okay.
Okay. And that's, because that's like a, I don't know how to say it. That's nothing. I don't know. That's like, that's so common that's a normal.
Okay.
You know what I mean? Where you're, yeah. You know what I mean? That's, you can open up any textbook and see that stuff. Okay. So that's I'm like, I don't know. I don't have any videos of that.
No, that's fine. Even if you send me like the few pictures that you showed me, that would be more than sufficient, because obviously we can see the hand placement.
But I'm reversed. Okay. I would have been at her head, and that's what I'm like. If it was shoulder stuff, I would have had her on her side too. Okay?
Yep, that's what she said.
So I would have had her on her side, and then I'm compressing, because when you do the fascial releases, you can do it sitting. Okay, but I like to lay them either down or on their side. Okay, and then you can compress better front to back. Okay, and then I've got control of their arm, so I can compress if you're on the fourth rib, fifth rib, third rib, because the scapular thoracic dynamics of the way your shoulder moves, the scapula has to move, and that's why rowers get so many rib problems, because of the using the serratus and the scapula. And so when you want to release the rib cage, then you compress from the costosternal to costovertebral compression. Okay, and then you can use the scapula, get it out of the way. But if I'm working rib 4, rib 5, rib 3, that's breast. That's breast, and that's breast. But it's compression, it's, you know, and so if she said I was massaging, it would have been like, does that feel better there? Does that feel better there? Take a deep breath, you know, how's, you know, that type of thing. So take a deep breath, move your arm up. I would have been, she would have been laying on her back, and I would have like turned her head, you know, and done like one hand would have been here pushing down, you know, like this. Sometimes I'm here between the breasts, you know what I mean? But so sometimes you're cross patterning, okay, so that you're doing it from this direction, okay. So, but my hands would have been more like this as opposed to like this, okay. And then side lying, you're like this, okay. So like her head would have been like, if this is the body, that's the head, okay. So I would have been like this, okay, with my hands on, so that my thumbs. So like your thumbs connect from the costosternal to mid-axillary line to costovertebral, then you compress the rib, and as they breathe, then the rib you're able to release. It's called a release. It's releasing the rib. Okay, so if I did sideline techniques, that's my sideline techniques. Okay, if it's supine, it's supine. Okay, supine, laying on their back. Yeah. You know, and sometimes you go from prone to supine to seated. You know, I mean, you got all these different ways to treat them. You know, that's why I'm like, it could have been any one of those, you know, positions, but that's the positions I would have used for those rib techniques. And again, if she felt offended, I'm like, why didn't I sense that? And that's my burden. But anyway, so I guess.
So it seems like you obviously have, which is great, you have a very set routine that you go through with every patient. Is there any reason you can think of why you wouldn't have walked her through the steps as to what was coming up next or what you're going to do?
Other than if I thought I had explained it to her at the visit before, because this was a follow-up visit. Okay, that would have been the only reason why. Would have been if I thought I had explained things to her at the visit before. Okay. Instead of having, so that's why then I'm just going through it because I've already explained what I'm going to do. You know what I mean? So does that make any sense?
Yeah. So she had said that she. I don't know if you recall that at all or no, but that's
I know.
Yeah, so she had said it showed, like, in one of the videos you showed me, it looks like there was some butt palpitations.
Right.
So that's what she was in there for before, was that. And she says she remembers leaving and telling, like, people on her cheer team that. And they kind of talked about that. Right. So that's when she was in there. So.
But she was there before.
On a different occasion?
I think the time before, or was that the only time? I can't remember unless they pull it up. But I thought that was a follow-up.
One other time?
Yeah.
Do you know if she had been in there recently as far as the follow-up would go?
Wasn't that the second time? I can't remember. I don't know if that was the...
So...
Was that the second time of recently? You know what I mean? Like I saw her once and she came back? Or no? So I have no recollection of her as went to high school.
Yeah, right. So that's obviously going a few years back. So, she's not alleging that she didn't think anything inappropriate happened,
before,
in her previous visit. And she said that it sounds like she had some other issues that she needed physical therapy for and stuff. So she's not alleging anything inappropriate. It just stuck out in her head that she thought, hey, he was kind of like poking at my butt.
Right.
And then, and that's when.
Yeah, you guys definitely need the records then. You know what I mean?
Okay.
Because that stuff would be documented anyway.
Okay.
And if because maybe that's what I'm thinking is was that a second visit or a first visit? I can't. I purposely have not. I didn't want to. You know what I mean? So it's like just let it be.
And then, so after your appointments, like, are your notes pretty detailed? So, like, from this visit that we're talking about, that's...
It should say, like, OMM with ME and MFR and strain, counter strain to the, cervicothoracic, rib cage, and then my notes are usually pretty good.
Okay.
Okay, my notes are usually pretty good. So myofascial release, strain, counter strain, that's this positioning stuff too.
Okay.
Okay, so that's, HVLA is cracking the back. Okay, so if you see HVLA in the note, that's high velocity, low amplitude. Okay, so HVLA is like a cracking.
Okay.
ME is muscle energy.
All right, hang on.
Sorry, yeah, HVLA
right. Yep.
is cracking the back. That's high velocity, low amplitude.
Okay.
ME is muscle energy. That's where you, again, it's like working with the patient. Okay, push here, push here.
Okay.
Strain, counter strain is you put them in a position where, okay, does that hurt now? No, okay, now just breathe. You try and put them in a position where it doesn't hurt. And I always say myofascial release, you combine with the strain, counter strain, so that as they're breathing, you're releasing, you're following it, you're moving further because you're getting a release. So as they breathe, and as okay, if I'm here to start, I'm going to get more release. So you go farther and farther. Okay, I restored length. I've gotten them down to another rib. You're following the pattern. Okay, so it's like I've been called the body whisperer. It's like you feel it. And most of the time my eyes are closed. Okay, because I'm doing like I'm doing right now. Like I'm feeling it. And that people say I do that in my lecture too. I close my eyes.
Well, you've done it in here. I've noticed, right? Yeah.
I'm just saying that's the way, because it's use the force. It's like you feel it, and that's what when I did cranial. Okay, cranial is where like you put your hands on the head. Okay, and you're trying to feel the cranial bones move. Go figure. Okay, and when I was a student, I took Dr. Greenman, who was the guy who, like I said, wrote the book, 20-hour course, couldn't feel it. Dr. Mitchell, Fred Mitchell, whose father invented muscle energy. These are like the gods of manual medicine. Heads of rock, I still couldn't feel it. Viola Fryman comes in so that was 60 hours, and I still couldn't feel it, okay? And so Viola Fryman comes in from California. She's like 70, 75, and she was an older lady, and she was older than the other two, so she was old. And I finally felt it, and it's because the way that she described it to me, to the class, was that it's a triangle. It's you, the patient, and the spirit above, and it's this triangle pattern, and you have to get into that because you don't want the bad stuff to come back into you, because then you get all bad. You got to be able to pass it. It's this conceptual thing, so that you're trying to get into, like she was talking about how you can actually unwind them, like if they were in a car accident. As you're going through this, you actually get them into positions that they went through, and as you unwind them, the pain goes away. It's esoteric. It seems strange, but it's bizarre that's medical. Okay,
right.
and literally, I'll go through gyrations with them because I'm actually unwinding them of what pattern built it in. So if they got built in that pattern, if you do a Rubik's Cube, you unwind it the right way, and you solve it in less than a minute. Okay, so if you feel the tissues, okay, that was brought down here, then there, and all of a sudden they can release. Like the video showed that girl with the leg thing, I did the releases, her range of motion doubles. I can test that stuff beforehand, like I was showing with the girl sitting. I put my hand on her bum, pain goes away, no, pain's still there, I change my hand, pain's gone now. Okay, I know that that's then the angle or the vector that I need to do to unwind that. Okay, so it's totally, yes, if I would have gone further, that's natural, because she's getting length and I'm unwinding it, and so that's when I finally felt the cranial bones move, was when I was able to connect. It's very powerful for me,
Right, I can see that.
So that's the thing is, did I somehow, I obviously must have to her, reached the line where I was feeling connected, like, you know what I mean? Did I get into it too much? Did I feel like, there it goes, you know what I mean? And you just ride the body rhythms. it's hard to describe, but it's what osteopathic myofascial release is about, okay? And it's unwinding, okay? You can write that. I don't use that word, but that's a medical term for myofascial. It's unwinding. You unwind them, and it's the release of the fascia. You know, it works. You know, I don't know how else to say it. Do you have a rib problem? I can show you.
Right. Not currently.
You know, but
I'm sure at some point though that I get here, I'm gonna start feeling my aches and pains, right? So, I mean, that's why you're here.
Right.
You're here because it's under investigation, okay?
Right.
We want to talk to you. We want to find out what you have to say about it.
Right.
And like I said, I mean, I'm just going to go through this. I'm pretty sure I've covered everything with you that I want to cover. I just want to make sure I haven't missed anything that she said because, you know, I'm not going to hide anything from you. I'm not going to keep any secrets.
It's
Right, obviously it's your whole profession. It's about who you are.
It's not even the profession. It's who, me. You know what I mean? Like, there's such an important trust, and to feel that I violated that with someone, that the sexual stuff, for, you know, it's the trust. That's the hard part for me. Okay, because that's the whole thing. Sorry.
No, you're okay.
To break someone's trust, that irritates me. Okay, sorry.
No, you're fine.
You can't. What I always tell people is you can't get that bad. You know what I mean? That's the way it is. You know what I mean? It's like, okay, you know, it's done, and that's me. I just, I don't know. You honor that. You respect that. That is the vital thing. Okay, and somehow or other that hurts. That hurts. You know, I don't know. Okay, but I'm sorry.
No, you're perfectly fine. I'm sure if I put myself in your shoes, I mean, it's weighing pretty heavy on you all the way around for a multitude of reasons.
Right.
So there's a couple things that I want to do here. Obviously, I want to get the videos because it does illustrate what she and you are both saying happened, right?
Okay.
There are only a few minor places where you guys kind of split the road there. Everything you're telling me is everything she told me. So it's not like she's telling me anything else, okay? So what you're saying that you would have done is what she's saying you did.
Okay.
Again, what we're looking at is maybe perceptions, misperceptions, that she felt that she didn't know what was coming or what was going to be done for explanation purposes. And again, this is what, you know, she's saying.
Right, I totally understand.
But what she's saying happened is exactly what you're saying happened.
Yeah, because I talk to my patients all the time. That's why I make, you can see the videos. I have a whole website of education. You know, I mean, it's Gymnastics Doctor Facebook, Gymnastics Doctor YouTube, gymnasticsdoctor.com. It's all about education. It's all, that's, my company's Gymnastics Doctor, the sports medicine professor. You know what I mean? It's like, that's what I'm known for. You know what I mean? As a physician, I've been the National Contributor of the Year for the sport of gymnastics 5 times. Not even a coach has been Contributor of the Year 5 times.
Right. I didn't know who you were until I started looking you up, obviously, to see who you were and what you're about.
But when you have that, do you understand the trust that people have to have on you to that's what hurts, because that's sacred to me. You know, that's sacred.
And so with you saying that, so I think that's part of why she is so upset, right? Because she puts that trust in your hands, right?
And that's I'm like, how did that trust get, that's what hurts, is how did I violate that trust? You know what I mean? And that's, what did I say wrong? What did I do wrong? Why did I breach it? Because, you know, was I trying to get into her space, like talking to her about her social life, her family life? Because I do that a lot, you know what I mean?
I'd say that's, I'm not going to say it's irrelevant, because obviously she was a little concerned about the like on the Instagram picture. So I don't want to say it's irrelevant.
So she did say that. So that's weird, because you know, that was, you know what I mean? Like, you know, I mean, they're all, it's, you can, I don't know if you can pull my Instagram records. I have like 1,000 pictures. I just go through and, you know, like, you know, so, you know, because that's what I see with Instagram and Facebook and stuff, is there's a lot of injury stuff, you know what I mean? And that's what, okay, who's wearing the boot, anyways, it's a total different process for me, okay? So, it's not, it wasn't even her, you know. I wouldn't even know if she was in the picture, you know. To me, like an Instagram picture. Why would? That's why I keep going to, like, why would that set her off?
Yeah, so I would say the reason, I don't want to say it completely set her off, and I don't want to say it's irrelevant, because it is relevant.
Yeah.
But I think the reason why she was concerned about it is coming off of what she felt happened.
Yeah, but that tells me that, anyways, I'm like, okay, I'm looking at what's behind the curtain, what other issues did I open up Pandora's box for her? Was she stalked before? Was she had, what other issues are there that she may have had that I infringed upon, that she has built up walls for? Whether it's, I don't want people in my space, you know what I mean? Like I don't want people in my space, whether it's physical space, mental space, to get connected with. I don't know, because that's what I do. That's how I try to connect, because I need to. It's just the way that I work, you know what I mean? And that's why my patients love me. I mean, that's why I like us, because I talk to them, I listen, and we share stories, and you know what I mean? I don't have to go to work, I get to go to work. You know what I mean?
Yeah.
And so it just rocks my world. I don't know what.
So that why it would be really helpful if you can rack your brain a little bit,
right, sure.
To get any amount of details from this specific one, because she is saying that there was that communication there, right? So does it feel good? Does it hurt? Is it feeling better?
Right.
So the part the breast part, she's thinking, well, your whole hand is on her breast. She felt that communication wasn't there as to why your whole hand would be on her breast.
Right.
The way you're explaining to me and you're showing to me, I perfectly understand it, right? What she's saying is that there wasn't that communication there as far as what was going to come next, what was going to happen. So she's not understanding, okay, I can understand half a hand on my breast, on my shoulder, but I'm not understanding why his whole hand.
And I don't even know if my whole hand was or not, you know what I mean? But I know that if I'm on those ribs, I'm going to be around that whole breast issue. There is no question about it, you know what I mean? So, yeah, but like I said, it was, to me, a pushing, a releasing. If I was doing that, it's not a caressing, a grabbing, a groping. You know what I mean? It's a releasing. It's a different form of touch. And that's the part that bothers me. Is like, how did she get a different perception of the trust, the trust of the touch? You know what I mean? It's like, wait a second. You know what I mean? Because it's like, poof, there goes that lecture out the wall. It's like, because I always tell people sense a different type of touch. You know what I mean? Like, and so, I should be able to be on her breast, but have a medical on breast. Okay, you see what I'm saying?
Yep, I understand.
Okay, so yeah, I was probably on her breast. Okay, there would have been a reason for it, and it wouldn't have been a groping reason. And that's the part. I'm like, how did that get lost?
Right.
Okay.
So then the same thing for her vaginal area is that I think it sounds like Dr. Koven had explained to her, hey, he teaches this procedure.
Right.
His hand will be in the crotch area.
Right.
I don't know that he specifically used the word crotch, but that's the word she used.
That's fine.
Obviously, probably as a doctor, he didn't use the word crotch, but that's what she's saying.
Right.
So she said that that is, a standard procedure you guys follow, that you've trained the office how to do that, you've trained other people how to do that. So what her concern was is that she did not know that your hand was going to go inside her underwear.
Right, to move the underwear out of the way.
Mm-hmm. Right, which I saw those videos very clearly.
Right. So that's why I'm like, okay, that's where, if I didn't prep her properly, that's where I'm like, okay, then why would, I can't. All I know is that I'm talking to her through it, and if I did it, because I can't say whether I did or not, because I can't remember. I mean, it's just reality. It's like I would have explained stuff to her, okay? And so if I didn't, it was a screw up on my part for not, and I don't know why I didn't, okay, if I didn't, okay? But that's because that's SOP. It's like, just do it. You talk to the patient, you tell them what you're doing, you do it. You know what I mean? If I didn't say it, if she was... Did she miss it? I don't know. Did she not understand what I was saying? Like, this is what I'm going to do, and it didn't compute to her? That's possible, too. In other words, like, did I say, okay, I'm going to do this, and it didn't register to her what I was going to do? I don't know. okay? Or did I try and explain stuff the time prior, if this was a second visit, because a lot of times I'll explain stuff the first visit and then just assume, okay, explained it the first time type of deal, okay? But the kinetic chain, I always talk about a kinetic chain, that's like I'll show it on the videos, from your ponytail to your heel, whatever. But the process of doing what I'm doing is second nature. So did I, for whatever reason, do it with thinking that I did say, that I could say, yeah, okay, that's a possibility.
Okay.
That I thought I had said it and didn't, okay, because when something's routine, it becomes routine, okay, and so did I fuck up and not say it, okay? Well, obviously in her opinion, yeah, okay, or did I say it and she didn't hear it, okay? In other words, what I was saying, A, B, C, she heard D, E, F, okay? Because it's interpretation, So what I thought was being said was not what she was hearing.
Yeah.
Okay? That's legit too, But if it doesn't, to me, it doesn't matter. What matters is how she felt, So whether so maybe legally it makes a difference, I don't know, but the bottom line is, she felt violated, and that's my issue that I got to figure out why, because I explain things. I'm constantly in communication with my patients, and it obviously wasn't in a way that it affected her, okay? It obviously wasn't in a way that she understood, okay?
Right.
So however it was that I explained to her, it didn't compute to her, okay? And that's an issue. That's why I'm saying that everything has to change, because I need more safeguards. If it has become too routine for me that I can start making mistakes by being too routine. That's an issue. That's where I got to, okay, what else can I do then? It's like throw some cold water on me. Wake up, Larry. You got too routine. I got too comfortable with it. Or something. I don't know. But it's a huge wake up call. Okay, and I need to. It's my clinic will never be the same again. It's bottom line, and it's going to suck because I like being able to. So I got to figure out how I still can be a mentor. I got to still figure out how I can still be able to connect with the patient, talk with the patients, and work through, because so much of it is mental, and you can sense that, and work through that. And when I'm working on the patient, I'm also trying to establish that relationship to work through the mental part of the component of the stress, too, And so it would take a lot of the doctor-patient relationship, whatever, that's too cold for me. It's like, it would take a lot of the essence out of what I do. But I got tough, I can't have this happen, because the drawing, to me, the absolute line is this trust line, and that's I can't let that be breached again. That hurts. That really hurts, and that's where I'm like, okay, you got to change, because you can't have that happen, even if it's by accidents, of course, but you don't want it to even happen by accident,
right?
So.
Because I think maybe some of this could have been avoided.
Well, I gotta have other, now, like, okay, hindsight 50-50 or whatever, I should have asked her better to explain. Well, yeah, that's what I keep going through. How did I not explain it to her better? How did I not, a lot of that could have been avoided if I would have perceived something that she was uncomfortable, of course, and also that she didn't understand what I was doing. I'm like, those are two huge things. It's like, how could you not understand that she didn't understand? How could you not understand that she was feeling uncomfortable? What?
Yeah, and that is what it boils down to.
Right. That's what I'm saying. That's like, what the frick? Like what? And that's. But it's so, because it's like, that's not good. That's bad. Okay, that's very bad, and you got to. It's like, yeah. But does that make it a legal issue, or does that make it a, like you said, the medical people? It's like, yeah. Yeah. So okay, I need to have better written consents, like I've already drawn up a draft. If you feel that, during your office visit today, a medical student, a nurse, a MA, a resident, a fellow, and a physician assistant all may be in the room with you and all may touch you. And if at any point during that time that you feel that you don't understand what's going on or that you feel that they're touching you inappropriately, please stop and let the person know type deal. That's like a paragraph that I came up with, okay, do I need to have that on every single one of my things, like set to them, by the MA, when they get their heart blood pressure done, that needs to be in there, but beyond that, it's got to be, okay, if I'm doing any of these techniques now, it's expensive, it's cost prohibitive, but do I have to, if I don't have a rotator in with me, do I have to go get a rotator, do I have to go get a nurse, do I have to pull someone out, and so that's there now, that's done, it's like, okay, that part is guaranteed, it's like, if I'm doing these techniques, there's someone else in the room, that's done, so that's like, okay, I can't skip, it's cost, it's a cost thing for having someone else in the room,
right.
So, but tough, it's worth the extra expense to go through what the hell I'm living right now.
So again, in law enforcement, it's your witness, right?
Yeah, well, that's what I mean. It's like, it's basically to double check you or whatever, because, if I'm slipping up, then the other person at least is there to say, hey, Dr. Nassar, she looks uncomfortable, or hey, Dr. Nassar, I don't get her, but most of the time I'm, explaining to the resident what I'm doing too, or a medical student. It could have been a medical student. I don't know.
Yeah, and I obviously don't have that information right now. Okay.
It could have been a fellow. Fellows doing a year-long rotation. So there's medical students. All right. So she wants to go into medicine, and so anyway, so she's coming in and spending a week with me to just observe and go through. So I have how high school students do that, job shadow type stuff, So I have high school students in there a lot, so that's what it is.
So what is Dr. Kovan, where's he at on this whole thing, or what has he said?
We had that conversation, but that's what he said. It's like, that he told her that when they had their conversation, we said Larry does this is what he explains, and that it was totally medical, and and that, but he said, because you complained, we don't, because of what happened at Penn State, that's what the dean said too, because of what happened at Penn State, we're not sitting on this stuff, and I said, I encourage it, because we don't want that, and that's why I'm like, yeah, Jeff, you did the right thing. I don't feel any anguish towards him, or, like I said, I voluntarily, boom, that's fine, because I don't want any, curtains, It's like, no, there's nothing for me to have a curtain about, okay? Because it's there, you talk to any of the other doctors and stuff, it's like, It's like I'm doing the same stuff. And that's why it's like. I'm sorry.
No, like I said, the more you talk, the better. So you don't have to apologize.
But I'm just trying to explain, I guess, it's there. I'm sure there's nothing. My hand placements are my hand placements are my hand placements are my hand placements. Whether she was 10 years old or whether she was 84 years old. I mean, I've got a singer, a jazz singer. But anyways, and it doesn't. It's the same. It's the same. And you're in their private areas. That's why it's got to be trust. And that's the sacred thing to me, is the trust. And that's what I can't get over. That hurts. And that's what I can't get over. Okay? Is that how did I violate someone's trust? And whatever. I'm sorry, but I don't want to go there again. Okay.
So, you know, where we're at now is that if you can send me those videos.
Right, I got the Dropbox.
Okay.
Link, okay. You sent me an email, you said, right? So
yeah.
Because I have to send you that link.
Just prior to calling you. So,
okay, so okay.
So check that one. You'll have an email from me.
Okay. Do you have a card just in case?
I do, yeah.
Okay, I appreciate that.
And this has my office number that I called you from.
Okay.
And then it also has my email on there.
Okay.
And if you could send those to me, that would be great.
Oh yeah, I'll send that tonight. Get some popcorn.
What, you know, from what you're showing me and explaining is what she is telling me happened.
Okay.
You know, the difficult part of reading through this, obviously, is right now it's titled as a sexual assault report.
Yeah, that hurts, but that, yeah.
Because that's what she's reporting, right? So right now, obviously, technically, you're the suspect in that sexual assault report. It's under investigation, though.
Okay.
So we want to find out what did happen. That's the whole purpose of a police investigation. You know, it's not to jump to conclusions, it's not to take sides, it's to find out what specifically happened. So in seeing what you showed me here today and what you're going to send me, the one option that may be available to us, and I need to talk to her first, is a polygraph examination.
Sure.
And a lot of people have a misnomer that they think that's a lie detector test, and it's not. It shows both. It shows whether you're being honest, and it shows whether you're being dishonest.
Okay.
It appears to me that you're telling me the truth sitting across me, unless you know you're a great bullshitter, and you know you pulled the curtains over my eyes this whole time. But in combination with what I'm seeing here today, you know, I feel like you're telling me the truth. I mean, you're coming in here voluntarily, you're wanting to clear your name, and that's what a polygraph can be used for also, is to clear your name.
Whatever is needed.
So it's not, the TV show calls it I hate TV shows. You probably hate medical TV shows, right? Just like I hate law enforcement TV shows. You know, 3/4 of the stuff isn't true. So it can clear people also.
Right.
So if you're sitting here and you're being truthful with me today, and everything you've said is the truth today, in combination with these videos, what that would show is that you did it for medical purposes, not for any other purposes, right?
Exactly.
I've been investigating sexual assaults for the last 8 years. I have not run a polygraph like this, where it would be medical versus, say, a sexual assault.
Okay.
I would need to consult with her first to make sure that that's something we can do. So I don't want to say, hey, you know, let's do that. I want to consult with her first to make sure that that would be a viable option for us.
Okay.
I would like that to be a viable option, just because, again, you know, I hope you didn't sit across the table from me and, you know.
Right. No,
because then that would help clear you. And again, the police investigation is to find out what happened, right? And it's not to say that she had any ill intent for filing a report, but when we're talking about, again, communication, what her perception is, and this is the way she's feeling, which is what resulted in this report, right? So that can help on our end, from the police end, help clear up. And right now there is just some real fine delineation between the two of you. But I need to consult with her, just because, like I said, I haven't ran a polygraph like that before. And so if that's something that you'd be willing to do, and she says that that's a viable option, then what we can do is get some dates and times. If it is viable, then generally those run at 9 a.m. or 1 p.m. We can do it any day of the week. And she explains everything, you know.
Would she benefit from seeing that stuff?
So she probably won't need to see that stuff. She will get a copy of my report. So I just met with the complainant earlier today. I haven't even had a chance to pull the complaint number, type the report. I just thought I'd try and reach out to you and see if I could talk to you today. Seems how I just talked to her. That's normally helpful. So what I'll do is I'll pull a complaint number. I will give you the complaint number so you know what that is. I've got to obviously type up the whole entire report. I'll talk to her tomorrow to see if she thinks that that would be something that she could run a test on. And then that way that'll help show that, hey, you're being honest sitting across from me from the table today, in corroboration, like I said, with what I'm seeing in these videos, that you didn't do anything criminally wrong.
I hope to God not, because that's, then I've been spreading criminal, you know what I mean? I've been telling people to go commit crimes then right and left, you know, because like I said, it's not just Larry's, you know, world, it's around the world.
Which obviously I can see that from there.
Yeah, and that's what I pride myself in, is educating and talking to people, and that's, it's just gone. You know what I mean? It's like, you know, we call it, you get knocked off your pedestal or something like that. You think that, you know, here I am, the person that lectures all over, here I am, the doctor of the whole thing, you know what I mean? And
turns your world upside down.
Well, yeah, it's like, okay, reality check, you know, one person that, you know, and it's all gone. And it's like, so I have to reconfigure and say, I can't, my life, you know, my wife, my kids, you know, my work that I built so hard on ain't worth, it's hard for me to say this, to try, because my life is about helping other people, but if this technique is going to create someone to have that issue, is it worth it for me to put my butt out on the line like that? And it from what I've been feeling, it ain't. You know what I mean? It's like, okay, Larry, you do a lot of work, you know what I mean? Like I do a lot of free work, and, you know, I mean, I just, you know, with autism and the community, a lot of community stuff, but it's like, so, you know, do you need to take a step back and say, you know, okay, you need to protect yourself more. You know, it's I don't like that thought process, but it's reality. It's now sitting in reality. You know what I mean? So do I need to change who I am to protect myself better? I might not like myself as much, but, you know, I'll get through it. You know, but that's. I still want to be able to get up and say I get to go to work. You know what I mean? You know what I mean? I don't want to have to change my work so that I have to say I have to go to work. You know what I mean? So that's going to be the hard part for me, is to figure out how to make these adjustments to, and the simple thing is, it's going to cost. The simple thing is someone else in the room. Plain and simple. Right. That's the simple thing. You know what I mean? And tough, just the way it is. You know what I mean? So that if it's going to cost us more money to have that in, then it's going to cost us more money. You know what I mean? Because it's going to take off from the staff. You know, so, and that's just tough, but that's...
So did they change anything or put any measures in place? So when you first were contacted, you know, obviously I think there was like a few weeks in between.
Yeah, so you know, when Jeff said that, we weren't really sure if it was going anywhere or not, you know what I mean? So we started talking, I think Jeff had started talking to Vicki, you know, our office manager, you know, okay, you know, we're definitely going to have to change things. We're going to, you know, have to, you know, have doors open or nurses or stuff, you know, so there was some discussion about it, but not much, you know what I mean, because of the fact that we weren't sure where it was going to, but it didn't matter. To me, it was already, what am I going to do? You know what I mean? So it was already in my ballpark, like, okay, you know, I started leaving doors open and stuff, and I'm like, boy, it's noisy, it's hard to, you know, it's hard to, and there's HIPAA violations with doors open too, you know, so it's like, okay, you know, so yeah, no, from that day on, I personally have been adapting to try and make changes, and the only thing that I have found is, do I need to have a person in the room? You know what I mean? That's just cost. Or do I just stop it? You know what I mean? And just like, but it helps so many people. So I think I'm going to be more judicious as to who so that way I don't have to have someone in the room as often. You know what I mean? Because I'm spending long time. Since 30 minutes, when was the last time a doctor spent 30 minutes to 60 minutes with you?
Never.
Okay. Would you appreciate that from a doctor who's talking to you, who's, I mean, like, I'm telling you, it's a standard that I guess I put myself, like I said, I just got knocked off my standard, you know, because everyone else was 15, 20 minutes, you know what I mean? And I've been able to do this and make it work, but you know what? I can be, I don't want to be like everyone else, but it's my wrestling, you know what I mean? That's how I got to figure out how I can protect myself and not have this happen again, because I obviously cannot rely upon my sense of what the other person is feeling. You know what I mean? Because that just got blown out of the water. Okay? That's like, you know, it's gone. I can't get that back. I can't say that, you know, in lectures even, you know, the sensation of, you know, the palpation versus all that stuff. I mean, it's gone. It just got proven wrong. You know what I mean? Right there. Bottom.
Which is true.
You know, so it'll never be the same. I don't know how else to say it. It'll just never be the same. You know, so that's my wrestling match, and that's where the university is going to have to, it's not just me. It's going to open Pandora's box because all of our docs are in the rooms by themselves. You know what I mean? And so,
right.
And at any point when you're in the room and you got another person in the room, it doesn't, you could be checking their shoulder and they could say, oh, you touched my breast, whatever, and it could be the orthopedic surgeon, and there's no one else in the room. How do you corroborate it? So it's like, okay, so it's not just me. It's like, how's this going to affect the whole thing?
Which is very true, which will be part of the university's investigation, obviously, and what they look at, like you said, from the whole university picture.
Right.
So that is what Christine Moore from the Office for Inclusion, she'll be in contact with you from their office.
Okay.
I asked her not to contact you until I could talk to you because I obviously, as a law enforcement agency, I like to trump the administrative investigation, so to speak. They understand that,
Right.
I talk to them about that all the time, so it's nothing.
That's fine.
So what I tell them is I always like to talk to the parties involved before they do. So I will let her know that I have talked to you.
Okay.
So she would be reaching out to you. I'm not sure exactly when, but she'd be reaching out to you. Their investigation is very similar to our criminal investigation, where they would talk to any possible witnesses. They'll talk to you, obviously. They compile a report. But then in addition to that, like you said, they look at, from the university scope of things, how things should maybe be handled differently.
Right.
And so even though we work for the university, we just handle the criminal end of things. So the reason we're investigating this is because you're in a leased office that MSU has that is basically contiguous to our campus.
Right.
And so that's how that gives us the jurisdiction here, as opposed to Meridian Township, where technically your building sits.
Okay.
So if you had any questions about that, that's why we're investigating it.
Okay.
What questions do you have for me?
Right now, it's like, do you know how long it will be, or what? I'm just trying to figure out what's our next step. How long am I? The waiting is tough on me.
Right.
It really is, and that's why I'm like, man, I'm eager to talk, to do. So I don't know. That's
yeah. So I just got to get in contact with a couple of people and talk to them. That she's given me names of people to talk to. Basically people that she's talked to.
Right.
So I need to reach out to them. I'd like to try and get the medical records, obviously, because those sound like, according to you, those would be pretty helpful.
Right.
I also don't like to have these take a long period of time. Right. So, it'd be my goal that hopefully that it would just be maybe a few weeks. And then we could have the investigation completed. Obviously, that would be dependent to, can we do the polygraph? When can we get the polygraph scheduled? So for your 5.5 weeks, is that kind of, how was that time frame put in place? Or how did they come up with 5.5 weeks?
That was just the dean just said.
Okay, just said, hey, so that ended June.
I've got a week vacation that's in there. So
So I actually leave for vacation myself that week. So what my goal would be, bar any unforeseen circumstances, is that we have this wrapped up before you and I go on vacation. Okay, so like I said, bar any unforeseen circumstances, I don't want to leave and go on vacation myself and still have some things to tidy up here. So I guess if that helps, that would be my time frame.
That's good. That's good.
So I have a couple people that I need to talk to. I'd like to get her medical records, talk to our polygraph examiner about a pitch in for a polygraph examination, so we can do that. And if you're available, basically her first available spot, we can get you in.
Right.
And then that would help also with the investigation.
Right.
Is there anyone that you think I should talk to, or that would be helpful to talk to? I'm going to talk to Dr. Covan, because obviously he spoke with her, he met with her. He knows you, he knows the procedure, so I need to talk to him. Is there anyone else that you think I should talk to?
I think Dr. Lemon. She's another one of our doctors.
Okay.
So Brooke Lemon.
Brooke?
Right, Brooke Lemon. She works with me with gymnastics, and she's one of our office partners and stuff. And she knows these techniques, too, and she knows what's going on. I personally talked to her because she's like she's a colleague that, she said, Larry, I watched you for 8 years. And I said, because I was worried about you getting yourself in trouble with that. He goes, and she said, You know, because she as a female, you know what I mean, because she's a female, so you might, that's why I'm thinking Brooke. You know what I mean? Because she'd be a female doctor, you know.
And you said, who is it that I could contact to find out who was in the room with you that day?
Vicky Curley.
Okay.
Right, Vicky, she's our office manager.
Is it C-U-R-L-Y?
R-L-E-Y.
E-Y?
Vicky Curley, V, and it's with an I.
Okay.
I think Vicky Curley, right. English is like a second language for me. I'm not very good at spelling.
So as we go along, if there is other people that you think I should talk to, or
I
that would
don't
be...
know what you, like, you know, doctors, that's why I'm not sure what you mean.
Yeah, or basically anybody that may have information that would be relevant to this investigation. It sounds like the dean maybe just got information, kind of second, third hand,
right,
so to speak.
Right. I think it would be Dr. Dietzel, Dr. Kovan, Dr. Lemon. You know,
Okay.
That would be the appropriate, you know, thing for that. You know what I mean? So, Destiny, she's our athletic trainer.
Okay.
Destiny Teachner Hawk.
My pen in there.
Sorry. Destiny, she works with me in the training room. Okay. She doesn't know anything about this. Okay. So she's totally.
Then I may hold off.
Yeah. She doesn't know anything about this,
okay.
but she's with me in the training room. She's like my voice. Now he's gonna put his hand on here. You know what I mean? So, because I work with the athletes there, and I do the same techniques with the athletes in the training room.
Okay.
And so she's always the one that say, all right, remember he's gonna do this. You know, so she's always over my shoulder talking to the patient. It's because I only got like 15 minutes. You know, there, so it's always a quicker thing. And so she knows my techniques, and she talks, you know. So she helps with the education of the patients, you know, from that to the athletes, you could say. We do this on guys, too, in case that matters, you know.
All right.
It's not like just on girls, you know what I mean? There's basketball players that, you know, with Kovan and other track athletes, you know what I mean? It doesn't, I mainly work with figure skaters and gym, but where I see the guys is mainly in the training room.
Okay.
You know what I mean? And so, and I've got a few guys that are in the clinic, but the vast majority are females because it's figure skating, gymnastics, and dance. That's my population, you know.
Okay.
But yeah, you know, and I've done this with guys and taped their bottoms too, you know, and all that stuff too. So it's not just unisexual. Okay, so, but anyways, that would be the coverage, I guess. You know what I mean? So. Yeah, so if I'm just trying to think of where else people have seen me, you know. So Brooke sees me with the athletes at Stars at the gymnastics club, you know, and so so I'm just trying to cover, okay, training room, you know, high school, Twist Stars, you know, type deal. So, okay, but it is what it is. I mean, I think that should cover it. I mean, because I don't know what you're looking for. You know?
No, that sounds good. And then the only thing that I would ask of you is, you know, I know you've been thinking about this a lot.
Yeah.
But as you continue to think about it, if there's no details too small, so if there's anything that you remember, and you know, you went through.
The only thing, like I said, the only thing that I remember is that there was that. I was hoping to, it's just me, to, okay, how can I help? You know what I mean? That's where I'm thinking, is that where I crossed the line, was because I had intent of trying to talk to her and how can I mentor her, and you know, what's, you know, she's like, what do you want in your career? You know what I mean? It's like how can I be the mom? How can I, you know, like, so that's the only thing that I keep thinking of, is that was an intent that I had, was to, as a mentoring. You know, I mean, no, she didn't come here for that. You know, I mean, she came in for.
Yeah.
So I'm like, you know, so I'm like, what? I think you had said something about her shoulders been hurting a long time. That's why I said shoulder. So, where I may have breached by doing something that was out of proportion was I purposefully was trying to get into a role of being able to mentor her. Okay, so by talking to her, you know what I mean? Like building that relationship, and over 3-4 visits, you usually can develop a relationship like that where people then like, you know, gee, I want to be a doctor like you, and, you know, can I rotate with you? Can I, you know what I mean? So, and so that's what I'm thinking of was I off on that too much of a tangent, you know, where my focus was off a bit, where I was thinking of that part and wasn't paying attention to the details of explanations? Was I distracted from that? Was, you know, that I wanted to be the shining light to come in and say, you know, I helped your daughter. You know what I mean? That's and so I obviously royally flushed that, you know, but that was part of what that was the agenda that you could say that was part of it. Was not just the body, it's the mental component too.
So you're thinking, if I'm hearing you correctly, that there may be a possibility that you were having conversation about other things while going through the manipulations of working on her body.
Right, and that's what that was. I know that exactly. I can't remember. Okay, because it's been so long. Right, I've seen once a week, then I can remember.
Right.
You know, but I remember that as a detail of thinking back. You know, that was an issue. So when I see an issue, I would have normally tried to mentor on that issue. Okay, so that's, again, it's nothing, I'm not singling her out. It's like, when I see an issue, I want to become a mentor, I want to be able to help the person from that standpoint too. Okay?
Right.
And so that's just, okay. So I don't know, that would be the details.
Yeah, and again, you know, sometimes as you're, and I'm sure you've thought about it a lot, but as you continue to think about it, if there's anything that comes up, don't hesitate to get back in contact with me and let me know. What I will do, though, I will talk with our polygraph examiner tomorrow. Okay. So I'll be able to follow back up with you tomorrow. Okay. Unless she's off. I don't think she's off.
Right, would I have to go?
So we probably won't do it tomorrow, so you don't have to worry about that. Continue on with your plans.
Okay.
What I will do, I will talk with her tomorrow if she's not off. I'm pretty sure she's here to see if it's something she thinks that we can do, because I will defer to her expertise.
Okay.
As far as whether she thinks that this is something that we can test on. And then what we would do is that I would give you a selection of dates and times that she has available, and then you can pick whatever date and time you want. Right, which would be good, right? We'll get you in here, get it taken care of. And like I said, she runs those at 9 a.m. or 1 p.m. They're generally a few hours long. The reason for that is, again, from whatever you've seen on TV, that stuff's not true. The test is a very small portion of the polygraph examination. So what happens is she has to do very much like you have to do. She has to get to know you a little bit before she runs the test. Because you're only tested, obviously, against yourself, right? So basically, she has to see what your baseline levels are. Like, she will make you lie. Hey, what number do I have up here? You lie to it so she can see how you spike when you lie. And I'm using layman's terms. She will explain it to you in technical terms. So basically what happens is that she has you lie to something completely unrelated to this. She'll write a number up here and say, did you pick this number? She has you lie to that, so that way she says, okay, here's what your charts look like when you lie. She goes through the exact question she's going to ask you, so there's no surprises. You know exactly what questions she's going to test you on. There's 3 questions that would be relevant to this investigation. And what those questions would be for, or what I'm hoping she'll be able to test for, is, again, what we're looking at is medical touching for sexual assault touching, right? So she would form like 3 questions after talking with you, because she needs to get to know you and find out, hey, what makes you tick? What do you think is awful? And then she formulates the test questions from that, and then you go through a couple practice runs to make sure that you're charting okay. Or say, for example, you know, even if I were to sit in the chair and be a little bit nervous, she'll say, are the lights on? Yes. Kind of to bring your levels back down. But again, she'll go over that all in technical terms and explain it way better than I can. And then she'll run the test. That is the small portion of it. She normally has to run a couple tests to make sure that each chart is reflective of the other chart, that she's not getting abnormal readings or anything like that. And then you'll know right then, which you're sitting across from me today, you should know what the answer is going to be, right? you should know what the answer is going to be, that, hey, it's showing that he's honest.
Oh, yeah,
right?
I'm sorry, right.
Yeah, so there should be a question in your mind of what the outcome should be. Yep. And then I'll be available here too, because obviously it's my investigation.
Okay.
So we would meet afterwards. Well,
Okay.
basically when you show up, I'd come get you again. I'd walk you down and introduce you to her.
Okay.
She runs the test. I'm here throughout the whole thing though. And then after the test, I would meet with you again.
Okay.
And again, you know, you're saying, hey, here's what I did. Again, from what I'm seeing,
Right.
you know, it seems like that's the case.
Right.
And then...
But it just frustrates me. It like I said,
but it affects you in a whole nother capacity.
Yeah. That's the whole thing. It's like this, it's whatever it takes, you know, let's get through it. But I just want to get through it because I got to figure out how to make amends, you know what I mean? It's like, how do you change your life, you know what I mean, so that you don't have this ever happen again, you know what I mean? And I've got to take it out of my hands, you know, and that's where it's, you know, it's going to cost money, and that's just the way it is, you know, and that's just tough, you know, but it's worth it to have someone else in the room, and that's, you know, as I keep talking, as we're talking, you know, that's the one thing. That's the one thing that we wouldn't even be here right now, I think, if that person didn't, because that's what you said, is when that person left the room is when she had that change of thought, and that's if that other patient would have been late, if, you know, there's so many, like, if that patient would have been late, if there was no other patient, you know, then if it was the last patient of the day or whatever, you know what I mean, if that person would have left the room, we wouldn't be here right now, you know.
Right, or we may just have to go talk to that person that would say, yep, hey, here's what I saw, right? So that's that would be quick and easy for us.
Right, exactly.
And unfortunately, that's not where we're at. And so, you know, because it sounds everything she's concerned about obviously happened after that person left.
Right, yeah. Like I said, I wouldn't know, you know what I mean? Because I don't remember when the person left or what have you. I know that the person would have left, and if you said about 3/4 through, so my appointments are long, that makes sense. Because, you know, if the other person that's came into the room, been in the room 40 minutes or half an hour or whatever, you know what I mean? That makes sense, that they would have been going to see another patient.
Okay.
You know, so that makes sense. You know what I mean? So that would make sense. So, okay, so, I am, whatever you need done, just let me know. Okay,
well, I appreciate you coming in here. I didn't expect you to be like, I'm coming right now, so I appreciate that. That's extremely helpful.
Yeah, no, it's the sooner, this has been, in a way, therapeutic for me too, okay? It's like I got a chance to purge, you know what I mean? So, thank you, you know, for that. It was nice to be able to purge, to let it out, okay? So that helps, okay? So I do appreciate it.
Yeah, no, and I appreciate, like I said, I know a couple of times you're like, hey, I'm talking too much. We want you to talk a lot, okay? Because the more information we have, the more we have to work with.
Okay.
And so that's helpful. And again, so as you move forward, no details too small. So if you do think of anything,
that's going to be that's when every time you say that, I start going back in my head, okay, stop saying that. I just feel like I'm replaying.
But that's the way to help yourself,
okay.
You know, so that is the way to help yourself, is to remember any detail. And again, I know you see a lot of patients, and I know we're a few weeks out from...
Yeah, but what I don't want to do is convince myself of I don't want to convince myself.
Right,
that,
and I wouldn't want you to do that either.
You know, like, oh yeah, well I remember.
No, by no means,
like,
right.
You know what I mean?
I wouldn't want you to do that either.
You know, I don't want to start, distorting the memory in a sense, you know what I mean? So that what is she looking for? What are her detail? What am I missing?
No, I would not want you to do that at all. And if you don't remember, hey, you don't remember.
Right. I don't want it to be used against me because I can't remember, you know, but at the same time, I'm like, I know I talk to my patients. I know I explain things. It's irrelevant what I know. It's her perception of what she heard. Now, if I said, even if I remembered saying specifically X, Y, Z, if she heard A, B, C, then does it really matter that I said X, Y, Z?
Right, which is true.
What I'm saying? Okay, that's why I'm like...
That's true in our profession, too.
Yeah, that's why I'm like, okay, she didn't get it. She didn't get it, okay? And that's the issue. She didn't get it, okay? And for whatever reason, whether I was distracted, you know, I mean, it could have just as been as easy as that. I could have been distracted and thought I had explained things. You know what I mean? So that's what I'm
Which
saying.
is a perfectly plausible explanation.
That's it. I mean, like, so I don't want to hallucinate and start.
Yeah, and I wouldn't want you to do that
trying
either.
to reconstruct the thing. You know what I mean? So, but if something does come to me, you know, I'll tell you, of course. Okay. But I'm trying hard. Okay. So.
Yeah, no, I appreciate you coming in here, especially when I called you up and you came right in, so that's greatly appreciated. You obviously got a couple different processes you're dealing with. I mean, your employment process, this process, the university's process, so it's a lot to have to deal with.
Yeah, well, thank you, though, for your time. Thank you for being you. You were good. And just it was comfortable to talk to you. You know what I mean? So I appreciate that. Okay.
Thanks. So as soon as you can, that would be your first piece of homework. Send me those videos.
Yes.
I'm going to leave for the evening after this.
Yeah.
So if you don't get to it till
I'll get to it
later tonight or sometime tomorrow, that's
think
fine.
of anything more important?
That's right. So, you know, as long as I can have them, you know, by some point tomorrow, that would be great.
Okay. And there should be the other videos that I was trying to find, and the other videos that I was trying to find, and I think there was another PowerPoint I was trying to find, you know. So, but yeah, so that's what Dr. Kovan has a link to the Dropbox, and so does Dr. Dean has a link to the Dropbox, and so does Tom Cooper have a link to the Dropbox. You know, because I'm like, guys, you all know what I do. You know, Tom Cooper, he's more administrative, so that's why I made it. It was for Tom. You know, I mean, I put the Dropbox together mainly for Tom. Okay, because he's like the person in charge of the department. Like, okay, so he would have no real clue. You know what I mean? So that's why I wanted to put that together and say, okay, Tom, this is what I do, because he's not a medical person. He's actually a lawyer that works with, he was like our interim department director when Dr. Pochin left, so he became the interim, and now we have another, Dr. Mukherjee is the new department director, so now he's stepped down again as the associate head. But Tom's the person that really oversees our clinic. Okay, so that's why I put that together, was for his knowledge, because he's not medical.
Which is exactly why it's helpful for me.
Yeah, okay.
You know?
Okay.
So, I mean, for you to come in and explain it to me.
Do you want those emails?
I won't need the emails.
Okay. It's my explanation to him, to Tom and stuff, you know, if...
So did you write, so you wrote an explanation to them of what you did?
Yeah.
That would, okay, so that would be helpful.
If
you have a copy of those, you can just email those to me.
Yeah, it should have it's just one email. It's like, here's the Dropbox link, and here's
so that would be helpful then.
Okay, yeah, because it should explain it, I think. I don't know, it's a long email, but I'll send it to you.
No, that'd be very helpful.
Okay. So anything else?
Nope, I don't think so. Just send me those videos, and then I will call you tomorrow to let you know whether we can do the polygraph or not do the polygraph.
Would she need to see this stuff at all? Do I need to bring this back?
No, she will have access to my whole written report.
Oh, and she'd have access to the Dropbox for you if there's anything.
And then she will go over that report with you in detail to make sure that there's no misunderstandings as to what I may have wrote or what you may have said. So that way she can appropriately, just so that way she can appropriately run the test, right? Because she doesn't want to, the reason why she goes over the whole report with you is, say for example, I misquoted you, or I incorrectly wrote something in the report, and she were to test you based off that, we don't want that to happen. So we want to make sure that what I have wrote is what you have said, so that way she can test you correctly, because she is not involved in my investigation at all. Her only involvement is to run the test for me. So she will have no part of this investigation in any other way, shape, or form. It's for her to run
Technician.
Yes.
Technician. Okay.
For her to run that test for me, and then for her to say, hey, honest or dishonest, okay?
Right.
And then we'll go from there. And then, like I said, I've got a couple people that I got to talk to anyways. And again, hopefully we will have this all wrapped up and good to go by the time we leave on vacation.
Okay. Thank you.
Yeah, I appreciate you coming in. And you have my contact information, so if you need anything, again, I'm going to leave here probably in about a half hour. I do get email, though, obviously, to my mobile devices. So if there's something that, you think, hey, I got this question or whatever, a concern,
I do get that, and I check that even outside of work, so.
All right, well, thank you.
Thanks for coming in.
Okay.